attendance, and it is important for everyone to attend the classes, because without having 80% attendance, then there's no point for certification, because we deal with human life when we talk about caregiving. So it's a pleasure once again to be here. I want to welcome everyone. It's great to have you here in this training, this professional diploma in caregiving level 4 training. It is important to note or to let you know that we have different levels of caregiving. So we have 1, 2, 3, but level 4 is the professional level. That is to say that before the end of this training, the 4 weeks that we have, you should have all the skills necessary to be able to function maximally in the caregiving field, because you automatically will be a professional at that point. So it's nice to have everyone here. Well, like it is my tradition to do whenever I have trainings on caregiving, today is the first day, so we would not really delve deeply into the nitty-gritty. I want to start by giving you a very short story, telling you what actually brought me into caregiving. Because when I'm done, I'll ask 1 or 2 persons to tell me what is actually, or what was actually their inspiration for them to venture into this field, like for them to enroll for this program. So I'm going to hear maybe from 1 or 2 before we move into what we have for today. Well, what took me actually to go into caregiving was some years ago, so many years ago. I want to just tell you that whatever you do in the caregiving field comes from passion. If you are not passionate about it, then you cannot perform well. You cannot do well. Whatever you are not passionate in this life, you cannot perform well in that particular, in any of those aspects. So it wasn't part of me to really veer towards the caregiving field, but something happened that gave me the high level of passion that I have today, that made me to move to delve sector. Some years ago, then I didn't know much about caregiving. Well, I didn't know. I was at work. It was on a Tuesday morning, a very fine Tuesday morning. I was working when my phone rang. And so when my phone rang, in the middle of fully entering data into the computer system, I was doing something with the computers that time at my workplace. When my phone rang, it was my mother. I saw my mother called me. So I responded and I asked her, "Mom, what's wrong?" She now told me, her voice shaking, she delivered the news, with a shaky voice. She told me that your father, she told me, Dorothy, that your father had suffered a major stroke. She just told me that your father had suffered a major stroke. And he was in the hospital. His condition was unstable. And she also said the doctors were unsure of his prognosis. Like they didn't know exactly what to do, what was actually wrong with him at that point in time. When I heard that, it seemed as if my whole world was crumbling. It seemed as if the whole world just stopped at that very moment. My father, a military officer, that has risen over the years, has risen. I've never seen him weak. I've never seen him in any of his vulnerable states. I've never, throughout my years, I've never seen he has always been agile, filled with high spirits, always in control, always in command, commanding people. And those of you that have anything to do with the military, you understand what I'm saying. So, but when I went to the hospital, immediately I went to the hospital, I saw my father. I requested to leave the job. I went and I saw my daddy. I bore witness over the years. I bore witness to my father's immense struggle. I saw him struggling in the hospital. He had difficulty speaking, moving the right side of his body, and completing the most basic self-care task. I mean, the things he used to do. Seeing this man that I have known all my life, as at that time, in this vulnerable state, reduced to such vulnerability that is unheard of, was really heartbreaking. It was emotional and heartbreaking for me. But throughout it all, I was there. I fed him. Sometimes I even had to, I patiently worked with the rehabilitation therapist. At times he grew frustrated. At times he just felt that he should just die and leave. But I kept offering him reassurance and encouragement because, I had this attachment with my father. So I kept encouraging him. And slowly but surely, I began to see glimmers of hope and recovery. I began to see him recover gradually. Gradually, he was getting better. I could see light at the end of the tunnel. So it was actually in this dark moment, dark, meaningful moments that I discovered my true calling. Like I looked at it, I compared how he was before and after in this state. And so many things touched my heart. I decided to say, oh, I saw in the course of dealing with my father, I saw how just a little help, a little love, a little dedication, what effect it can have on someone's life. Because up until then, I didn't understand. The gratitude in my father's eyes each time he walked through the door made me feel happy, knowing that, yes, at least I played a role in his recuperation, his well-being, in him getting better. I made a life-changing decision that nothing will stop me from moving into the health sector. Nothing will stop me from becoming a see them happy. Though I want to wait, have the knowledge of caregiving. Several years later, I have, because that's just where my patient, my
Am I the only one experiencing a break?
You are not, so I can't hear her so from here.
Okay. So that was the only one. Thank you.
You're not the only one. You're not the only one out there.
All right.
Okay. What? Yes. Okay. Stop.
Or if I have a please, are we together? Can you hear me?
Yeah.
Hello.
We can hear you.
I think I was lost at points. Please, I'm only hearing Charity. I don't understand if others can hear me.
We can hear you.
Can
Can
hear
go
you.
on.
I've been waiting for you.
Okay,
Yes,
sorry.
we can hear you. We can
I
hear you.
think let's pray for network because today it's not a very favorable day. The weather is not. I just hope that all is well. All right. So as I was saying, because of that inspired me to actually go into caregiving because of the things I saw firsthand. So why am I telling you all this? Caregiving is an important and rewarding field, very, very important and rewarding. And this professional diploma program will help equip you with the knowledge and the skills that you need to provide exceptional care to those in need. At the end of the day, you may not turn out to be a professional caregiver, but I tell you that you would need a caregiver, either for yourself or you would be a caregiver to another person. There's just nobody that doesn't have one thing or the other, or is not intertwined in the caregiving field. So if let's just look at it this way. Imagine a world where the most vulnerable amongst us, people that are vulnerable, are cared for with utmost dignity, respect, and compassion. A world where the role of a caregiver is not just a job. Many of us, maybe we just want to be caregivers, we just want to have the job. We just want to go where the grasses are greener, where you get green grass, maybe. But I want to tell you that aside that, you have to, first of all, have that passion, be passionate about it so that you can transform lives and you can uplift the human spirit. It's all about the human being. The power of caregiving is very, very important for everyone, at least to have the knowledge of caregiving, whether you use it to be a professional caregiver or not. You can use it in their house. Most of us have elderly people. Most of us have neighbors. Most of us have friends. We have people that actually would need this from us. So I encourage this training, the way I love to do my trainings, because caregiving thing, just as I've shared my experience with you, you may have your own experiences. Feel free to share your experiences and engage in discussions. My goal for this training is that it should be an interactive one where everyone can learn, enriching learning environment where everyone can learn from each other. So that is primarily how it's going to be as we move along. At this point, I'm just going to share my screen so that we can start. Let's see, I need to know if you can see my screen so that we can.
Yes, we can see your screen.
Yes, we can see your screen now.
Decided to fly. I wonder why. Yes. So, thank you. So this training, practical. Thank you. Thank you. So our course outline, like we already have, like I told you, today is the first day. So we are just going to take the first 3 modules every day. Every day we have the training. We are going to look at 3 modules. This training is made up of, this training is spread across 4 weeks. Today and tomorrow, we are going to be looking at the first 6 modules. Today, we are going to look at the first 3 modules. And then on Saturday, tomorrow, we are going to look at the next 3 modules. And so we'll continue. But bear in mind that the last Well, however it is, I really pray that today the network will favor us.
I think it's from your own end. Our own is okay.
You can be certified. So let's look at this from what you can see here, a picture of a confident caregiver. Who is a caregiver? Like we've been talking about giving care, caregiving, different levels of caregiving. Who is a caregiver? Before we actually delve into that, I would like to pause at this point, if network would favor us, to find out, maybe someone would want to share with us what actually inspired you to enroll for this course. Like what is behind you enrolling for this course? The reason I'm doing this, I don't like to have a training whereby I will have sole monopoly of it. I don't like it. I like to have interactions. I like people to talk. I like to hear the voices of people. So can someone, either a man or a woman, tell us what actually motivated you to enroll for this program, or what you'd like to do? Yes, the floor is open, please. Who will bail the cat?
Okay.
Who would like to talk? Okay, please.
Is already up.
Okay, I can see Okay's hand up. Okay, please.
Yeah, so okay, can you hear me now?
Yes, I can hear you. Please go ahead. I can hear you.
Yes, we can hear you.
Hello.
We can hear you.
Okay. So like you said, the driving factor for me is the passion.
Okay.
Because I've been on development work for over the years. I've been working in humanitarian work for over the years, and
Wow.
we have been programming for caring for caregivers and vulnerable children across hard to reach areas, different communities. In fact, we're currently managing over 44,000 households, vulnerable households, caregivers,
Wow.
and also the passion to take the care of their health, emotional, psychological, different issues in the community, because we are dealing with vulnerable children and caregivers under our care. So you really have to sometimes want to go extra mile to provide care and support to them and be able to ensure that they are doing, identify the needs they have, ensure that those needs are well attended to and others. So it's a work of passion. It's like in an area of call. If you don't have that passion, it may not last. You may maybe just want to come in and just what is the passion that made me to have lasted on this humanitarian job for years. Is the same passion that what me to also enjoy what I do. Thank you.
Thank you so much, Madam. Thank you. So I saw okay, but I don't know. Can you tell us your name, ma'am, so that I will know who has actually responded? to my question because I saw okay.
Chukwu Onyeze, yes.
Okay, Chukwu Onyeze. Thank you so much. So you see, that's beautiful. It's nice to really hear the things you have been doing. That means you've already been playing a very good role in the caregiving world before now. So it's nice to hear you lend a hand in serving, in helping humanity. Thank you so much. So that's from a lady. I'd like to hear from a man, because over the years, when I have these trainings, I hear men, you know, most men are a little bit reluctant when it comes to caregiving. They feel, oh, it's a woman thing. They feel it's about, so, but I'm happy that I have men on this platform. I have men that have credible men that are actually in this race, that we are moving this journey together. So can anyone help us? A man this time around. So a man can just help us say something, and so we move to what we have for today. Thank you.
Okay.
Okay, which man wants to talk?
Good evening, everyone.
Good evening, Mr.
Good
Emmanuel.
evening, everyone.
Yes, good evening. Okay. Go ahead, sir. Thank you.
The reason why I choose this course is because I have been waiting to do something for the community, what I can offer to the country, what I can offer to humanity. And I thought that going into the caregiving profession will actually help me to do something for the community. And I also have passion for caring for people. I don't want to see people suffering. I cannot stand the fact that somebody needs my help and I will not be able to help because that is not my field. So that is actually the reason why I am jumping into this caregiving job. Sorry, my network is really bad.
No problem. We're hearing you.
Can you hear me?
Wow, that's
Yes, we can hear you. We heard everything you said.
Okay.
so much, Mr. Emmanuel. You see, it's so nice to hear that coming from a man, because most times we most times we think that it's okay. It's nice to have you, Aisha. You're welcome. Maybe you had network issues. That's why you couldn't join us. So let's see what we have. Let's quickly move to what we have. Network is trying to be funny, but we would not allow it. So who is a caregiver? A caregiver is simply a person that is trained at taking responsibilities to help, to take care of someone that is unable to do what he or she is supposed to do. A caregiver is someone that takes care of a person, helps another vulnerable person to carry out activities of daily living, ADLS. As we progress, we are going to see some of these terminologies that would really help us to understand. So when you see the terminologies, you actually understand what we are talking about. So that is who a caregiver is. A caregiver could also be termed as a personal care aide. Sometimes you see that as we progress, it would be used interchangeably. You can have personal care aide or you can have caregiver. So anytime you hear me say PCA, that's personal care aide, you understand that I'm still referring to a caregiver. So as it is, in our line of duty, our major duty is to ensure that we help out with activities of daily living. We help our clients with activities of daily living. So that is primarily who a caregiver is. Sometimes, especially this part of the world, like I said, most caregiving duties that we do are not paid. That is that unpaid. For instance, like I took care of my father. I gave you that illustration when I started. I was not paid for it. So that's an unpaid caregiving that I render. Now, there is the professional one. Hence, you are having this knowledge because most of us on this platform, I believe, would want to make it professional, like to be paid for it. But aside that, we have been caregivers, most of us, even before entering this training, we've been caregivers because we have been helping maybe our aged parents, maybe our neighbors that need help, with care, one or two things to help out. That is primarily caregiving. So today we want to we have talked about, practically looked at the introduction of caregiving. We've talked about the meaning of caregiving, and I have said that as a caregiver, you need to be passionate. You need to have the passion. You need to be patient. You need to be understanding. You need to be empathetic. You need to have humanity in view. You need to have a soft spot. That soft spot is just like Mr. Emmanuel said, should be something that should be in you that you cannot watch. You can't watch another person suffer. You can't just be there to see another person going through pains and then you don't do anything. That's the soft spot I am talking about. So as a caregiver, there are many characteristics that you need to have. There are many things that you need to have. You cannot be a temperamental person and be a caregiver. Because like I said, caregiving is not a walk in the park. It's not, nobody should promises anybody that being a caregiver is all rosy. No, because there are going to be thorns and thistles the way we have in other jobs too. You are going to come face to face with people that may not even value your help, value your care. But because you are looking at humanity, because you have humanity in view, then you overlook all these things. That is the summary of it. We are going to have a very beautiful ride. I just pray that network aligns with us and then we'll get there. So we are done with that first module. We want to look at module 2, which is person-centered care. Please. At this point, before I start talking, because this is a very, very important module in this training, I'd like to find out if we are all together, if everybody is with me, if everyone can hear me, please. Before I start, we have to be on the same page. Please, can everybody hear me? Are we together?
Yes, we can hear
Yes,
you.
we can hear you.
Yeah, yes, we can hear you. We can hear you.
Yes. Thank you. So please bear with me anytime I pause to ask if we are together, because I like to carry people along, and don't forget that you are the reason why I'm here. So I have to carry everyone along. Nobody should be out. So we want to look at person-centered care. Now, in everything, before I delve into this, I want you to understand something. Everything that we are going to learn on this platform in the course of this 1 month duration is not only going to be useful for you as a caregiver, it's going to be useful if you make use of it in all areas of your lives. Over the years, we've had people like those of you in the professional diploma group, the last batch of graduates have testified, so has others done too. They've also testified. If you follow the principles, if you follow the teachings that you already know, I guess, but you are building upon as a result of this training that you are having, it would help you in your different life, in your family life, in your work life, in your everything. You are just going to move. So we want to look at person-centered care today. What is person-centered care? Now, for a caregiver to be able to succeed, for you to succeed in the field of caregiving, then you have to take note of this particular point. It is a concept that describes a certain way of thinking about people and how you treat them. Now, as a caregiver, don't forget that you deal with people that are vulnerable, people that have one issue or the other, maybe with Alzheimer's disease, maybe with dementia, maybe with bipolar disorder, maybe with schizophrenia, maybe with all this. You are a caregiver and you are there for a reason. Good. I have not seen the set of people that interpret things like people that are not well. Let me use that word. Let me just put it in a layman's language. You find out that people that have issues, elderly people that maybe they have dementia or they have one problem or the other, they are very, very sensitive. Those of us that have grandmothers or we have mother-in-laws or we have people that are elderly and they have one challenge or the other, you understand what I am talking about. You may mean to do something in the proper way, but they misconstrue it. They are taking it the other way. And at the end of the day, if you are not a passionate caregiver, you feel bad and regret having attempted to be of help to them. That is how it goes. But person-centered care simply describes something. It teaches you or it describes a way of you thinking about people, treating them. How do you treat people? Do you treat people with respect? Do you treat people with empathy? Do you treat people with compassion? Or are you arrogant? Or are you temperamental? These are things that every caregiver needs to understand. That is why I started by telling you that if you want to be a caregiver, then you should be prepared, because it's not a walk in the park. Especially those of us that would have to go out of the country to relocate to go and be caregivers outside. Oh, I tell you, it's not rosy at all. It's not. You understand? But what will keep you moving is your passion. What will keep you moving is because you have a goal, because you have a target, and because you have humanity in view. That's what will keep you moving. So now, person-centered care is just all about putting the individual at the heart of their own care and support. That is the A to Z of what person-centered care means. Put the person in his or her own heart of care. For instance, you want to help a person, and you want to help this person. Are you superimposing what you want on the person? Of course not. That's not how a caregiver should do. If you're a caregiver that is person-centered, you seek to understand, what does my client want? Okay, I am attached to helping a person that has dementia, to be a caregiver to a person that has dementia. Okay, let me study this person and understand what this person actually wants. What are his likes? What are his dislikes? How does he like his food? At what time does he like to take a nap or to sleep? At what time does he like to relax? All these things are things that you need to know. Center your care around the person. And do not forget to also ensure that the person is part and parcel of his or her own care. Caregivers that are person-centered, they seek to know who they work for. They seek to know what are the likes and the dislikes of the person that they work for. They seek to as I was saying, you put them in the heart of their care. Now, person-centered care is a philosophy that recognizes each person as a unique human being. No matter what that person is, the challenge of the person, be it dementia, be it Alzheimer's disease, be it schizophrenia, be it bipolar disorder, anything at all that is the challenge to that person. Look beyond that thing. Look at the person as a unique individual. That is the philosophy of this person-centered care. Look at the person as a unique individual, someone that had a life before this challenge, someone that made decisions for himself or herself before this particular challenge, someone that had a work life, that had a church life, that had a family that was recognized in the society, someone that had his or her own life in control before the inception of this particular illness or challenge that the person is having. So that is person-centered care. And so when you are actually rendering care to that person, if you're a person-centered caregiver, you have to make sure that you incorporate the life of that person into whatever you are doing for that person. You promote their strengths. You promote their choices. You promote their direction. You promote their happiness. You promote their well-being. You don't superimpose what you want on the person. Now, I'm going to break it down. I don't know if we understand. I try to bring it down so that everyone can understand. I don't want to go use all those big terminologies. I want us all to be on the same page. So I was saying that this person-centered care is a philosophy that recognizes each person as a unique human being with their own sets of needs. What I need is not what Mr. Kingsley may need. What I need is not what Mrs. Onyeze, if I'm not mistaken, may need. What I need, my own preference, I may prefer something different from what Messi Bassi prefers or Idarabo. And so we are unique people. We are different people, distinct in our own choices and in our own direction. So as a caregiver, you have to look at all those things. Now, instead of you having a one-size-fits-all approach in everything you do, person-centered care focuses on you tailoring the care to the unique needs and desires of the individual. For example, now I'm going to give you an example like I like to do so that you understand what I'm talking about. Imagine that you are caring for an elderly man. For instance, let's give the name, maybe John. Let's say John. You are taking care of an elderly man as a caregiver attached to John. Now, rather than assuming what's best for John, you just assume, okay, John, okay, I think he's supposed to take tea and not coffee. I am going to serve him fried rice and not jollof rice, instead of you assuming what's best for him. Person-centered care would involve you sitting down with John to understand what he actually wants, to understand his daily routine, to understand his hobbies. You talk with John, what are the things you like to do? John can tell you, oh, I love to play chess. I used to be an award winner some years ago. I like to play chess. I like this. I like that. That way, you are getting to know what his strengths are. You are getting to know what his likes are. You are getting to know what his preferences are. Ask him about his preferences for things like maybe meal times. When would you like to have your meal? Would you like me to serve you? Would you like to take this? Person-centered care dances around the individual. Dances around what the individual wants. Dances around what you can do to emphasize the strengths of the individual, the choices of the individual, the direction, and to help in the well-being of the particular person that you are serving. It is important we know this because there's something about BCC UK, like I told the people that enrolled for this training, they actually believe that people that come from MJB, from us, that they can stand the test of time. That's why I said in employment, even though we don't recruit people, we're not a recruitment agency, we tell people because we built our name over time, and we just like to tell you the way it is so that one little thing on ethical practice would not spoil our relationships. That's why we tell you. But nevertheless, because of the people that we send out that pass through us, they deliver. That's why I take my time to explain, because we have caregivers that, you know, one challenge or the other, and they end up coming back, which it has not happened to us anyway. So that's why we take time to explain. So as a person-centered caregiver, ensure that your interest goes second, while the interest of your clients is paramount in your work. That is the A to Z of what we've been talking about. Okay. At this point, you can, like I advise people to do, I'm checking the chat box and I'm going through. If you have any questions, please put it there, or you can ask. I welcome questions a lot and contributions, because I learn. The more people contribute, the more I learn. I repeat, nobody is an embodiment of knowledge. So let's move. So that is practically what person-centered care talks about. People that are person-centered get to know the people they work for. They get to know their lives. They take a walk into the lives of the people that they work for so that they can understand their strengths, understand their choices, understand their preferences, and as such, they are able and willing to dance around. So like I was saying, I use John as an example. that a person-centered caregiver will ask John, will sit with John, will talk to John, will work together with John to create a care plan that aligns with his personal values and lifestyle, will help to empower John to make decisions about his own care whenever it is possible. Adapting the care to accommodate any changes in his condition or preferences over time. That is who a person-centered caregiver is. It is important for us to know. So the key to that is just how you treat people. Treat people as the experts on their own lives. Do not say because a person is not well, you want to now be an expert in the life of the person. Of course not. Of course not. Regardless of the challenge, the person knows how best his life should run. So what you do as a caregiver is you stay within your limits. You don't exceed the limits. Your limit is to ensure that you understand what this person actually wants, and you help to support what that person wants for the total benefit of your client's well-being. So that having said, I think we understand what person-centered care is. Now, this person-centered care, like I said, is a philosophy. It's a way of thinking. So as I have said all these things that I've said, you have to ask yourselves these questions at the end of today. After this training, sit back and ask yourself, do I think this concept has value? This person-centered care concept I talked about, and we'll still be looking at in detail. Do I already apply this concept in my daily life? Because some of us, if not 3/4 of us, have already been using this person-centered concept in relationship with our maybe spouses, maybe our children, and we seek to know what they actually want, and we wrap it our own around what they actually want, lending a hand to helping them achieve what they actually want. So that is it. Ask yourselves this question. Now, the person-centered care is organized into three categories. One, the first category is learning about people. That's the first thing. As a person-centered caregiver, you must learn about the people that you work for. Very, very important. Learn about the people. Two, value the people. Value is very important. The way we relate with people is important. If naturally, that's why I say that this thing is not only for caregiving alone. If you use it, it will help go a long way in our lives. It helped me. It helped build, shape me, give me another paradigm in my life. I just had a shift in paradigm. I had to start thinking differently from the way I used to think before I actually had this orientation. When you are person-centered, you learn about people, you value people, and you support people. These are the three major categories of person-centered care. Now, let's look at learning about people. How do you learn about people? That's what we are going to look at. But as I like to do at this point, please, I'll need to know, are we together? Do we have any questions? Should I proceed? Hello, house.
We are together.
Proceed.
Okay, thank you.
We can hear you, ma. Thank you.
Together. Okay. So as I was saying, it is important to learn about people. Get to know the people you care for is important. The very best caregivers will always try to learn more about the people they work and care for. That particular point cannot be overemphasized. I can't overemphasize it, because without it, you cannot just function as an effective caregiver. Now, that process of you getting to know someone fully is often called discovery. Even for us, we take as humans, even for myself, I take time to discover myself. I take time to learn more about myself. I take time to discover myself. So as a caregiver, it is important that you discover, you take time to learn about the people you work for. You learn about them, you learn their strengths, you learn their challenges, you learn their abilities, you learn everything you need to know about them. And also appreciate them as the complex human beings that they are, and that we are. We are different people. It's what we call individual differences. That's to say that two people cannot be the same. Very difficult for you to find two people that have the same, everything the same. We all have our different We are unique in our own ways. We are unique in our own ways. So when you work with someone, make an honest effort to really get to know your client as a person. Eventually, you travel out, you want to work as a caregiver, not only traveling out, even within your where you are, you have to attend to someone to work as a caregiver. It is important that you discover, you make an honest effort. You try. Don't just stay without trying. Try to learn about your clients, because as the relationship grows, they learn to trust you. They may open up and become more comfortable sharing. It happens aside the fact that you are a caregiver, even in a real life setting, like I told you that most of these principles also go outside the caregiving world. In the course of this training, initially, most of you would agree with me that when we started running the art, and maybe those of you that have just taken your first trainings with the MJB management, you will agree with me that the trust was not there. You were like, oh, these people, are you sure they are really going to do this program? Are you sure they are not just trying to scam us? Are you sure we are actually going to use the certificates? Are you sure they are going to give us these links? Are you sure this and are you sure that? So as time progressed, you saw, at least you heard from people, you began, when you ask questions, sometimes those of you that were able to reach me, to call me, like I talked with them. I observed that after talking with a couple of you that actually reached out, like I advise people to reach out on that platform to me anytime. Even I'm a caregiver. It's just like a doctor. Even 12 midnight, you can reach out to me. I'll pick the call, because I know when it comes to online things, people get easily scared because of how the world is. The world is very sweet. So people get, by bringing this in, I'm telling you that when you build a relationship with someone, maybe you talk to the person, you build a little, as time goes on, you begin to see that some fences, you are building the fence and building the fence, it builds trust. So as a caregiver, it is important that, it is very, very important that you have to align with your clients. Take time, go close, yet professional. Going close does not mean get twisted in between one thing or the other. That's not what I mean. I mean, getting close is that show genuine concern, show genuine love, show genuine efforts to help. And as you do so, you will build that trust. They may open up and become more comfortable sharing things with you. It is a normal human philosophy. It's a normal thing. When you build that trust with your clients, he or she, it's easier. It makes your work easier as well. So let's look at it. Discovering a person, discovering the whole person. Now let's move. These are some questions that you can use to help yourself to find out how, you can walk a mile into the life of your clients that you would be taking care of. Find out, who are these people, who are they, what have they done in their lives? You see, most of these old people, veterans, people that are having maybe dementia, elderly people in their old age, for instance, they had a life, like I told you. They built their youth around a particular thing. There were some that were professionals, maybe teachers, maybe doctors, maybe lawyers, maybe people that have had, maybe farmers that have spent all their lives surrounded in the farm, the farm surrounding them with crops and plants and all those things. Those people have their lives. All of a sudden, this illness cannot make them to just cut off from the lives they used to live. So as a caregiver, if you must achieve what you want to achieve, if you must be fulfilled in your humanitarian service, your humanitarian duty, then you have to ask yourselves these questions. What can they do well? What were their strengths? There are some that will, when they get close to you, they will tell you what they used to. Like my father, in his old age, he used to sit down, people gather around, he'll tell them how he fought the Biafra War, he'll tell them how he handled the ammunition, he'll tell them all those things. It brings back memories. It makes him to live his life, even though it is in the past, but it makes him to still feel valued. It makes him to still feel that despite the fact that he is in this state, that he's still a human being and he's still valued. So some of these things, when you understand it, aside the caregiving role that you play, I tell you the truth, this training, if you follow it back to back, you follow it conscientiously, you would see that it would help you. Even if you have elderly parents, you see that you will be a totally changed person when you approach them. And they will be surprised because you are coming now equipped with all the skills you need. So you ask yourselves like these questions: what motivates them? What meaningful activities? There are some elderly people that what motivates them is just seeing their grandchildren. No matter how down they are, no matter how weak they are, if you want to see sparkle in their eyes, if you want to see life return to them, just gather their grandchildren and let them come, especially those of them that are not staying with their grandchildren. Gather the grandchildren and let them come. So just seeing the grandchildren running around and then just them shouting, oh, don't go there. Oh, you are going to fall. Oh, you pick that. Just that alone is enough to make them well, to make them live longer, because that is what motivates them. So what meaningful activities do they enjoy? What would they like to learn more about? All these things are things that you need to know as a caregiver, like you need to find out. So let's move. Let's move and see. I crave your indulgence, please. At least for today, you know, we had network issues and we didn't start till 5 o'clock. So I crave your indulgence, and I'm pleading a special appeal that we may likely exceed 8 o'clock today. I am appealing and pleading just today. Cross my heart, it won't happen again. So please, I need us to really understand what we have to do. So now another slide we are looking at is recognizing and respecting worldviews and perspectives. Recognizing and respecting worldviews and perspectives. Now, some clients may see things differently from you. Like I already said, that we are different individuals. Their ideas about society may be different. They may have different religious beliefs, different political views or values. Remember, we are learning about them. We are still talking about learning one of the concepts of person-centered care, learning about people. Now, when you work for someone or you are a caregiver to someone, understand that differences make each person unique. Let's understand that people are unique in their own, how do I put it, in their own capacity. We are all unique people, different in our own. So if we understand that, it will be easier. So other times, you may feel uncomfortable. Sometimes your clients may do something that makes you feel uncomfortable or even upset. You may just get pissed off, you know, but always remember that your professional responsibility is to be tolerant and respectful. Now, in the caregiving duty, some of us, I don't know, may have maybe stumbled across some things on YouTube or maybe Facebook or things happening, especially to people that will eventually become professional caregivers that will need to go out, you know, to use our certificates, this acquired certificate to work outside as caregivers. Now, it is important for you to know, that's why I started by saying that you don't have to be temperamental. Temperament, put it away. If you have to be temperamental, please put it away. If you are temperamental, rather, put it away. My mother used to teach me something. I want to share it with you, that when you are very angry, you fold your hands and just stuff it into your pocket. It helped me. When I was a teacher so many years ago, I taught in a school. Pardon me, I like to tell stories. I like to tell stories because I'm a born teacher. I don't train, I teach. So please bear with me when I tell a lot of stories. It just makes us move on. So when I started teaching there, it was a British school. I was coming from another aspect. I was coming somewhere, you know, and I was moved to another place. So when I moved there, I observed that this other side, we handle children, like we handle them. But when I resigned from here and moved to the other side, they were using British curriculum, the standard and everything. They now said, I remember my proprietor said, no, you don't beat children, you don't touch them, you don't spank them when they are wrong, you don't raise your voice at them. When they do something, you just talk to them gently, you don't scold them. So I was wondering, I said, will I be able to cope? Because I don't know how to handle, I don't know how to take those things. I believe that you spare the rod and you spoil the child. So, but with time, at a point, I even had issues because I was forced to spank one or two, and it almost put me in trouble. But later on, I learned this thing. My mother told me that anytime a child does something overboard, and you really need to spank the child, and you are like, so angry, just fold your arms, stuff it into your pocket. Just ensure that you put it in your pocket. Clench your fist very hard. Just vent all the anger into that your fist inside your pocket. and breathe in and out, and everything will be over. So even as caregivers, as we progress, this training is packed. I must tell you, it's really packed. As we progress, you are going to see methods you can handle when you get it up to this place, because of course, you are going to have thorns and thistles. Just as I told you, it's not a smooth, it's not a walk in the park. It's not smooth. So what am I saying? Understand that people are different. When you are upset, remember that your professional responsibility stands out first. Do not judge. Why did you do this? Oh, you were not supposed to do this or this and that. No, do not judge. Take judgments. Don't be judgmental. While you may not agree with some of this point of view, respect their rights. Respect these people's right to think for themselves and to be who they are. Because, okay, let me pause here. We had someone move out. I think we had one of our caregivers actually go and work as a caregiver in a particular country that was a religious base. I don't want to be on this platform. So, but they had a particular kind of religion, and she did not align with that religion. She was on this other side, but she was there to work as a caregiver. So at a point, because she belonged, just as we belong to a big community, she belonged to some of this. And so one of the times she dropped it that she's finding it difficult to cope because most of the things they do in that place does not align with her religious beliefs. And, you know, people brainstormed, other caregivers gave her ideas and so on and so forth. Of course, I belong to that platform. So I told her something. I told her that your professional responsibility is number one. That if you were given your care plan, your service plan, and you saw from it that these people did not align with your beliefs, then you wouldn't have taken it in the first place. You wouldn't have taken it. So, but because you are there, you have the full responsibility to be professional and to understand that these people have the right to their own religion. They have the right to pray the way they do. They have the right to do the things they do. If he does not agree with you, no problem. You're a person-centered caregiver. So you recognize the fact that their perspectives and their views, you have to respect them at all times. So that was just the nitty-gritty of it all. So what am I saying under this? I'm trying to say that it's important that we recognize and respect worldviews and perspectives. You may find yourself in any country, maybe Canada, it may be US, it may be UK. Like I said, our certificates are globally recognized. Trust us. Maybe to Sudan or to Saudi or to any of the countries, you know, and you are stuck with any of such things. Remember that the world, people have different views, people have different perspectives, and many things mold their views. Many things make them have such perspectives, their background. The way my own background, I had a military background, is different from someone that does not have a military background. We all have things that happen to us when we grow up. It inspires our sense of reasoning, it inspires our views, inspires our perspectives towards things. So we should recognize and understand that as caregivers, we should be tolerant. We should understand how we should respect other people's opinions. We should respect it. Like I've once gone somewhere, I have a child from the path that I come from, we don't kneel down to greet. I just want to give you an illustration. We don't kneel down to greet. Even if it's a child, my child comes to greet me, just gives me a hug and says, "Mommy, good morning," or "Daddy, good morning," or an elderly person, "Good morning, ma'am," "Good morning, sir," and that's it. But, you know, where I work, it is in their tradition that they prostrate, the boys prostrate, the girls kneel or they curtsy to greet. You understand? So people, but if you do that in this part of the world I stay and I come from, people will just look at you and sometimes maybe just laugh and they will just wonder. So you see that people have different beliefs, people have different perspectives. What you think is not what I think. My own beliefs and views, the way I see things is not the same. So anywhere you find yourself as a caregiver, please respect the views and the perspectives of people. Now let's look at importance. What are those things important to and important for? Now, it is very, as a caregiver or in caregiving, it is important to understand the distinction between what's important to your client and what is important for. What is important to you and what is important for you. These are things that you must at all times be able to distinguish, because you have to see, as a caregiver, you have to see how to balance and strike the 2. Okay, this is another slide. Before we delve deeply into it, okay, someone is saying, do we get access to all the modules once or the modules covered each week? Okay, thank you, Mr. Collins, ITS07. All right, this is how it's going to go. Please pardon me, let me answer Mr. Collins. I'm trying to be person-centered here, you know. I have to lead by example. So let me answer Mr. Collins's question in the chat box. So Mr. Collins, what's going to happen is what I do is today and tomorrow, Friday and Saturday for this first week, at the end of tomorrow's class, I'm going to have the slides placed on the group, on the registered participants group. I'm going to drop the slides there for everyone. I don't believe in keeping all to the last day to give, because I know you would want to go back and brainstorm and prepare for your professional exams way ahead of time. So it is 2 days. When I'm done today, tomorrow is 10 to 2. When I'm done by 2 tomorrow, I'll send the slides together for everyone. I guess I've answered Mr. Collins's question. So please, at this point, aside Mr. Collins, please, is there any question so far or anything or any contribution before I continue? I don't like to do all the talking myself. Like I said, you know, I like to have an interactive class. I was only doing the talking because I was trying to hit up to say, oh, network, please don't be funny with us. Let me cover what we have for today. So please, do we have any questions or are we together? Can everyone hear me? I like to hear people's voices. That's what keeps me moving. Are we together, please?
I hear you now. Good evening, Ma. I am Idarabon Jonah Bobipe. I am really learning a lot from what, I'm really learning a lot from what you said. So I need to learn more. Yeah. Thank you, Ma.
Thank you. You're welcome. Thank you. Mrs. Ugweze Ijoma, your hands are still up. Do you have another question? Or it was since that time? Because I keep
No, I removed it. There's something I want to share. You know, you talked about concentrating or maybe trying to see what you can do to please the patient. You know, in dealing with patients, sometimes there are, sorry, I'm a physiotherapist. There are sometimes you want to attend to it. Sometimes I go to meet a patient. I just want all of us to have an idea. I don't know whether it will be useful to them. There are sometimes you go to see a patient, the patient will tell you, I'm not in the mood.
Very well.
The patient will tell you, I'm not in the mood. You know, for us here, we try as much as we can to either plead with the patient or force the patient to have the treatment. But I heard that over there is not the same. So I want to ask, if I'm sent to go and see a patient, a client as a caregiver, and I get there, let's assume it's domiciliary, and I get there, now noticing that the patient is telling me he or she is not in the mood. Don't touch me, I'm not in the mood. Please direct me, what should I do?
All right, Madam, thank you for that contribution. You know why I laughed? Because I've had this question a couple of times asked, and it's something that is very, very common. It happens. First and foremost, I want us to understand something. In this platform, I know you are a clinical psychologist, if I'm not mistaken. So that's a little bit different because it looks more into the medical. But on this platform, and as a caregiver, it is very, very important that you don't, at no point should you superimpose what you want to do on a client without getting the client's consent. Why? Because if you do that, you are not going to get the best. We are looking at caregiving setting now. We are not looking at you're like a psychologist or a medical doctor or a nurse. We are looking at it as a caregiver. At no point should you superimpose what you want on your client. For instance, like you said, you force. Oh, no. That's totally out of it. You don't force your client when you, as a caregiver. One, because if you do, your job is at stake. Especially, like I tell people, in Nigeria, anything goes. I always like to say this, in Nigeria, anything goes, like it's, but when you have to go out of the country, you know, to render caregiving services, please, at no account should you force a patient or a client to do whatever he or she. Someone said, can I ask a question, please? Okay, Mr. Kingsley, just hold on. After this, I will ask you, Mr. Kingsley, please. So I know the questions that will come because I can imagine. So, ma'am, I don't know about your setting as a clinical psychologist, but as a caregiver, especially outside in UK, don't worry. By the time we get to the end of this training, that is before we finish, these questions, you will answer them yourselves. But let me answer for the benefit of responding to you now. On no account should you force a client to do what he or she doesn't want to do. That is why we are learning. We have to learn the techniques. There are techniques, there are skills that you use. We are going to get to how to handle behavioral challenges. We are going to get there. When we get there, you see that there are ways that you can make someone to do what he or she doesn't want to do in a respectful manner. In fact, you can even make the person want to do what he or she doesn't want to do because of the way that you have put it across. So as we progress, you are going to understand, ma'am. You will see it and you'll answer. And I'll remind you when we eventually get to that place, Mrs. Waze, I'll remind you. Thank you so much. Mr. Kingsley, Iyamo, you wanted to ask something. Please, can you ask?
Oh, okay. My question is similar to the one the lady just asked. The only difference is I was going to ask that when you go for your job that day, and like she said, and the patient says, I'm not in the mood, I'm too tired, and you try to pet the patient to go through it, and the patient refuses. So
to get in the mood, yeah.
Yes, to get in the mood, yes. So can it be said that the person has done his or her job that day if at least the patient did not go through that therapy?
Yes. Let me say it this way, like we are actually going to take time, but please bear with me. Today is the first day, so let me explain, because we have lots of us that wish to go out so that we don't get. Now, this is what happens. There is what we call, when you want to work as a caregiver, you have your service plan, you have your care plan. Now, the service plan tells you what you are expected to do for a particular client. Maybe for John, they tell you you will have to brush his teeth. You'll have to ensure that toileting is part of your duties. They'll tell you your duties. Now, if you, for any reason, that's what caregivers are taught, that maybe you walk into a client's room, we'll see it as, when it gets to communication, I think we are going to have it today, the third module for this training, communication in caregiving. Now, if you walk into a client's room and the client is not prepared or ready for that particular service that time, and you have done everything possible using the skills within your disposal to ensure that your client, the person actually aligns with what you want, and the person does not, it is not counted against you in any way. Why? Because caregivers, we don't work in isolation. We have what we call a care team. As a caregiver, you have a nurse is a part of the care team. For instance, that John, you are the caregiver. John has the nurse, you have the doctor. Maybe if it's a person that has a stroke or something, you have the physiotherapist. A care team comprises of a set of people. And you document. Documentation is part of what we are going to learn. Everything is documented. Nobody holds you accountable for not completing your duties when you should, especially when you have documented and you have reasons as to why it is not completed. And most importantly, if these reasons has got to do with the clients not responding to what you want to do, nobody on the surface of the earth will find you wanting. Nobody, especially outside. That is what I want us to understand. These questions are coming rather early, because when we progress, we are going to see how to dissect. Someone is talking. Who is talking? So that's it, Mr. Kingsley. Do we have any other person who is trying to talk? Okay, Mr. Emmanuel. Emmanuel, I don't know. I think that network challenge should be coming from your end. Because... Hello, Mr. Emmanuel. Okay. Please, can everybody hear me? I hope it's not from my end. Are we together, please?
It's not from your end, ma. We can hear you.
Okay, I thought I was the only one having that challenge. So, with that being said, don't worry. Our questions are, you see, we learn every day, and it's important that we have a walkthrough, like we understand what we have to do. We ask questions, we contribute. I equally want to learn from you because there are many of you that are well-read. I know on this platform, we have baristas, we have nurses. So I also want to learn from you. So ask any question. If I don't know it, then we would rub minds and we'd see. So let's move to important to versus importance for, because our time is moving very fast. Now, what is important to, it is very, very necessary or important for us to be able to differentiate or distinguish between what is important to and what is important for our client in caregiving. Now, what's important to an individual? Let's look at something being important to, T-O, maybe I should, important to. Now, what is important to refers to things that are meaningful, valuable, or significant to the person you are caring for. Meaningful, valuable, or significant to the person you are caring for. These are the preferences. I prefer tea to Milo. I beg your pardon. I prefer coffee to Milo. Preferences. I prefer to take my bath in hot water than prefer it to cold water. I prefer hot water to cold water. Preferences. Habits and aspects of their lives that are central to their identity and well-being. That is things that are important too. As we are on this platform, there are things that are very, very important to us, that are dear to us. They are important, like your preferences, your habits, things like that. Those are things. It includes those things that make you happy. That when you do, you are happy. You know, it's my grandchildren are important to me. Like my mother always liked to say that. My grandchildren are so important to me. That's something that is important. You know, things that make them fulfill, things that makes them satisfied. These are things that are important to them. Spending time with their friends, going shopping, things that are important. For example, let's say you are caring for an elderly gentleman. Let me use John. I don't know why I love that name, John. So let's say you are caring for John. Now, some things may be important to John. Some things that could be important to John could be maybe listening to his favorite classical music every morning. There are people that have some preferences. So it's important, listening to classical music every morning, enjoying his daily cup of tea in the garden. These are things that are important to him. Maintaining his routine of reading the newspaper after breakfast. So you see, forget, like I tell you, look beyond the disability, look beyond the illness, look at the individual. In anything you do as a caregiver, look at the person. Humanity is number one. Look at the person. Look beyond anything that is happening to the person. The person can spit on you. Sorry, I'm using this. It doesn't happen. The person can, we've had videos of maybe caregivers being maltreated, being treated anyhow by other people, maybe because this is black and this is white, this is this and this is that. It happens. But when some things can be when you look past an action, you look at the individual as a human being, understanding the condition this individual is. If you take that at the back of your mind, I think you can cross all hurdles. There's nothing, no hurdle that will be too high for you to be able to cross because of the passion you have involved in this thing. So these are things that are important. Now, important too, most times are personal preferences and activities that bring joy, that gives him joy and comfort. Gives him joy and comfort. These are things that are very important to him. So that is important too. Okay, so these things are things that are important too. So now, We want to look at things that are important for the individual. Remember, we are trying to look at the difference. What are those things that are important for? Good. Now, important for things are things that are necessary for the person's health, safety, and overall well-being. Take notes. The other ones are the things the person likes to do. Maybe it has become a habit over time. The person likes to do it. But important for are things that are very, very necessary for the person's health. Maybe taking medications, maybe doing exercises, things that are important for the person's health, the person's safety, and overall well-being. Now, continuing with this, like taking his medications I talked about, eating nutritious diet to maintain his health, using a walker to prevent fall. So these are things that are important for. So now, as a caregiver, for you to function well and to function maximally, you have to learn to have the skill to know how to marry the two. That's how to ensure that you are able to join the things that are important to your clients with the things that are important for you. Marry the two to ensure that your client comes out to ensure that your client is happy at the end of the day. You understand? So that is how to balance. You have to balance it. So having explained this two now, let us look at how you as a caregiver can balance these two. Of course, your client has the things that are important too, and the things that are important.
Can anybody hear?
We cannot hear her. I think it's network.
I
We
cannot
can't
hear
hear
her.
again. We can't hear again.
I think our network went off.
Okay, thank you.
Okay.
Together, can you hear me? I was lost. I lost myself even. Can we
Okay,
hear?
yeah, we can hear you now.
We can hear you.
Sorry, it's network. We pray that it's not disrupt us. As I was saying, it is important for a caregiver to be able to know how to balance the two in order for you to strike a balance between the two, because you have to help your client to be able to have a good balance between those two. What is important to and what is important for. All right. So as I was saying, the reason we have to balance is that as you do these things, you have to try to remain person-centered. Remember, we are still talking about person-centered care. So you have to try to remain person-centered and see how to balance the two. Okay, now let me give you an example of balancing these two. What to do. For example, meal times. Meal times. What is important to the individual? Maybe this particular person that you are handling enjoys having their meals in a relaxed social setting with family and friends. There are some people that like to do that. Maybe what is important to them, they can You understand? So they like to be in the midst of their family. That's something that's important to them. We are talking about meal times now. Okay. And they prefer home cooked meals with specific cultural foods. That's what they prefer. That's what is important to them. Then, what is important for the individual? For this particular client of yours, it is required that the client takes a special so you have to work with this individual to their preferred wake and sleep times. Work with them, hand in hand with them. Work with them, let them adjust their waking up and sleeping time in such a way that with their medication schedules. When you are close to your clients, when you have this rapport with your client, when you build the trust, when your client knows that you genuinely work towards his or her well-being or her welfare, it will make your job easier. That is why I tell people, learn about the people that you work for. Understand them, know their challenges, so that you'll be able to marry all those things. It is easy when you communicate with someone. Now, let us see. Let's move to the next slide. We have to try to move a little bit faster so our time does not run away. Now, effective communication. Learn to communicate effectively with the person. This particular point cannot be overemphasized. It helps in everything, no matter what you do in life, no matter the kind of job you do, you are faced with communication situations. In a workplace, effective communication is paramount. In your houses, in your homes, maybe you are a married couple, communication is very, very important. Without communication, nothing can happen. When you are able to communicate effectively, you understand yourselves, it makes everything easier. So learning to communicate effectively with a person would go a long way in making your job easier. This is very easy. And communication is not just talking as I am talking. It's not just talking. It encompasses a whole lot. The way you talk, your eye contact, your gestures, the tone of your voice, all these are included in communication. Why do you think that sometimes some people talk and some people perceive it as being disrespectful? It's because of the tone of the voice. It's because of the manner with which you stand, your nonverbal expressions, your communication. So it's like I said, that this training is packed. You have to really congratulate yourselves that you trusted MJB, because a couple of people have not joined us in this training because they are still finding it difficult to come out of their I don't know, belief. Some still think that because there's scam everywhere, so perhaps this is scam. They don't know. They are still there. But I want to, like I said in the group, I want to congratulate you for taking this bold step, because it would help. In all facets of our lives, communication is very important. Think about these things. What do their words and gestures mean? Aside your own, the person you are dealing with, it's not everybody that can communicate, because caregivers actually work with people that need help, like people that are ill. They need help with activities of daily living. So it's not all of them that will be able to tell you, please, I need water, or can you take this for me, or can you leave this? So you see, you have a lot to do. You have to learn their communication method. Their communication methods. You need to learn how to read the signs. You need to, okay, let me pause. Like I had my mother-in-law, of blessed memory. She was such a lovely woman. I like to tell stories, so pardon me. So whenever I go there from work, I stop by to see her. She doesn't talk a lot. She's a person that doesn't talk, but the way I see her, already I'm able to understand what she wants. Because I have learned her communication techniques. I know that when she's broke, like she needs money, you see her sit in the corridor and she'll put her hand on her chin and she'll sit in such a way that I don't need a prophet to tell me what her challenge was. So that she told me, oh, I need this, or I need that, or I need money, or I'm broke, or my daughter-in-law. No, she does not tell me that, but automatically I have read the cues that she has given me non-verbally without. So what am I saying? It is when you have a relationship with anyone, you are dealing with your clients, maybe your husband, maybe your children, maybe your friends, maybe family, you should learn their communication cues. It helps. Learn to effectively communicate with them. When they talk, what do their words mean? When they make gestures, what do they mean? Like my mother used to be, I remember growing up, when there are people in the sitting room, when visitors come and she doesn't want to be there, she doesn't live there. Perhaps maybe they entered when you are sitting there. She won't tell you, Dorothy, leave the sitting room for me. She won't say that. She just looks at me. There's how she positions her eyes. Just looks at me with the side of her eye. And I don't need a prophet to interpret it. I immediately just disappear. I just fizzle out from that sitting room immediately because she has communicated without talking. She has used a form of communication, and I have learned her communication skills. I mean, cues. I've learned her communication. So what am I saying? When we work with people as caregivers, understand, it's not all of them that can talk. Most of them, because of the challenges, they use nonverbal expressions to tell you things, and their expression speaks volumes. So you have to learn. How do they express their discomfort or pain? When they are having pains, how do they express it? Do they shout that they are all, you just see them squeeze their fists or they clench their fists? What they do, you have to understand. How can you recognize when they are becoming agitated? How can you make sure they understand you? These are things that you need to know. So each of us, communicates in our own ways. We use both verbal and non-verbal signals to tell other people how we feel, what we need. We use verbal, we talk, and we don't talk. Even aside there's a way you can communicate with your husband, like I do. I communicate with my husband, even if there are 100 people in that place, they don't understand what I have said. I may not say it out verbally, but just the non-verbal cues, just what I do, he understands. Or he too can communicate with me in the midst of a full sitting room or a full audience. Nobody understands what we are doing. So what am I saying? Understand your clients' cues. Understand their communication methods. It is very important. Effective communication is important in all facets of our lives. Right. You have just started supporting Mark. Let's take this this particular. I want you to ponder over it. Maybe tomorrow we can talk about it. You have just started supporting Mike as a caregiver, and Mark, sorry, I beg your pardon, Mark, not Mike. Mark communicates non-verbally. He uses facials and behavior to communicate his feelings and desires. You see, I told you not everyone can talk, would speak out verbally because of the challenges they have. If it's dementia, if it's the third stage of dementia, they don't talk with them, they just show you action, and you read the actions and spell them out and know what to do as a caregiver. Now, one morning, you are assisting Mark with activity of daily living. You are trying to assist him in putting on his clothes. And in the middle of the task, Mark pushes your hand away and stops looking at you. How could you find out what Mark is communicating? In such a situation, there are many things that have happened there in that particular scenario. Mark has decided to do that. But I know, like I was going to see this time, but I think it is important that we take this question. What we have here, from all the things I have said, I want the very, very distinguished professionals on this platform to analyze this. You are doing your normal duty of assisting your clients to dress up. He's not told you anything, no, or said anything, no, I don't want you to say anything, but he has shown you he has given you facial expressions. And in the middle of the task you are trying to assist him with, he pushes your hand away and he stops looking at you. Now I throw the question open to my very distinguished professionals on this platform. What do you think could be wrong in that particular setting? The floor is open, please. Let's rub minds concerning people. Thank you. Who is willing to help us? Who is willing to build a cat?
Please, could you repeat the question again?
Okay, the question is right on the screen. Can you see my screen, please? Can everyone see the screen?
Yes.
Okay, thank God, because I was wondering if I was the only person seeing it. So the question is saying that you started supporting Mark. The question is for everybody.
Class.
Mark communicates non-verbally, as he cannot talk. He's not able to tell you what his challenges are. He uses facial expressions and behaviors to communicate.
Can you hear the teacher talk?
One morning, you are assisting Mark to put on his clothes, and in the middle of the task, hands away and stop. What do you think is wrong in that particular way? That's who can help us, please.
Okay, can you hear me?
Please.
Hello.
Well, the cat. Okay, I can see Pounds. I don't know who is Pounds.
Yeah, it's
Hello.
okay.
Yes, please. Pounds.
I log out from my
your hand.
laptop. I log out from my laptop. It's okay. Okay, Chuko, I log out from my laptop to join with my phone.
Okay, our own is it our
Okay,
physio, our psychologist? Correct.
No, Chuko Onye is the one that spoke earlier.
Okay, ma'am. Ma'am, but I would have been happier if another person.
Okay, no problem.
So
no
that
problem.
it will not be Madam alone, because I know you are already in the field. So is there any other person who wishes to bail us, or Madam Chuku should still bail us?
Hello.
Yes, please.
If Mark is pushing your hands away and turning away from you, it's obvious that Mark is angry with you.
Okay, thank you. I think that is who just answered our question. Who contributed? Joy, am I right?
Yes, Joy.
Okay, Joy. Wow, it's
Hello?
nice to hear your voice. It's nice to hear your voice. You know, some of us, I have not heard their voices, but I've heard some that have actually reached out to me, but some I have not heard the voices. Thank you, Joy. Okay, Joy is thinking, Joy is of the opinion, it's like he or she is angry. Oh, not she this time. He is actually angry with you. Thank you, Joy, for that contribution. That's correct. Certainly something is wrong. So it could be anger after all. Do we have any other person?
Yes.
I heard someone say hello.
Yeah, this Collins.
Okay, Collins. Thank you, Collins.
Yeah.
Please go ahead.
Yeah. So I feel that Mark would also want to do it himself. He could also want to wear his clothes. He also want to do it himself. Maybe he doesn't want your assistant that day. His team could do it by himself. That's why he's pushing your hands away.
Wow, thank you. So you see, I'm happy because over the years I've been running this caregiving trainings. I've learned it, and I've met with people. So already it's going to be a very smooth ride for us. It's just going to be a walk in the park. Kusan, it's nice to have you here. I've not actually heard your voice since we started. So when I finish talking, I would like to hear your voice, at least a hi, to hear that voice that I have wanted to hear all along, that I've not heard, only on chat. So thank you so much. So these are, and we've had another one. It's either he's angry with you, and Mr. Collins said he's like wanting to do the task himself. These are very beautiful answers, contributions that I really appreciate. Thank you. So do we have any other person with any different something different?
Yes, please. Yeah. This is Kingsley speaking. From my
nice to hear your voice too.
Thank you very much. From my experience with my late mother, sometimes I feel Mr. Mark doesn't want to wear that particular shirt because sometimes when I attempted to change my mom's clothes then, she had a preference and she might be very hot at that moment. Maybe I was giving her something that was thick. So I think Mr. Mark doesn't like that particular shirt.
Oh, thank you, Mr. Kingsley. Thank you so much. You see, that's why I had said, so that means by extension, even before this program, you have already been an unpaid caregiver, an unpaid. I know mommy surely is not going to pay or wasn't paying
That's
you.
correct.
So
yes,
so you see that it's not only about relocating. Every day we get faced with situations where we act knowingly or unknowingly as caregivers, or those lofty and beautiful contributions. And I just wanted us to explore this. So all of those would be the reasons why some of people we care for don't need you to go extra. They need to be able to have a level of independence. When someone is having disability or someone is not feeling one challenge or the other, like I started telling you, they are very sensitive people. Those of us like Mr. Kingsley and others, if you have related with elderly people that are passing one challenge or the other, or people that are actually having one disability or the other, they are very sensitive. They are highly sensitive people. You know, they look at the things, you look at your gestures. If you genuinely are not doing your work with passion, if you genuinely do not like them, they know. They don't need anybody to tell you. Because they have those challenges, they are, I don't know how to put it, they are very highly sensitive. So it may be that you were overdoing it. Maybe you were not giving him and his how do I put it? You didn't allow him to do the work for himself, or you were superimposing, or you were overdoing. You did not allow him to put on his clothes. Maybe his hands were still good, but you say, oh, because he needs help, so let me wear him the clothes. And he's feeling, why are you wearing me clothes all out? Have I become, you know? So I don't know how to really explain, but all those things are practically one thing or the other, or they don't like, or they don't want that particular clothes. Maybe they want something else, and that's the one you brought. As we progress, you will learn that will help you. In a situation, as a caregiver, you are not even supposed to go and pick a dress for a client, no matter how. You are supposed to give a variety of clothes to say, oh, please, oh, I know this afternoon it's sunny. These are some, which one would you like to wear? You know, give them. Don't make them feel as if they have lost grip of their lives. That is what I want us to understand. Make them to feel that they have that autonomy and control over their lives. Nothing kills a person faster like that person knowing that, oh, I have eventually I don't want to use that word, but I'm trying to talk about, I'm trying to say, I'm not supposed to use it, you know, but give them their independence. Those of us that have had elderly parents, sometimes you want to overdo things, to make them feel more as if they are they are not used anymore. That is just the A to Z of it. So it could be any of those reasons. I wanted us to brainstorm on that. Let's progress, because our time is not very friendly. Then people, now I want to talk about valuing people. Valuing a person means seeing the best in them. See the best in a person. Value people. Person-centered. Value people. Respect people. You know, I don't know. It depends on orientation, but I value people a lot. Maybe that's why I easily went into the caregiving setting. I value relationships. I value people. I respect people. I look at people. I look beyond any challenge or anything a person is going through. I look first at the person. And that's how to value a person. Being the best in appreciating what they have to offer, accepting them just the way they are rather than what they have become. Looking at them as intelligent people, looking at them as graceful, looking at them as people that had their lives, that were up and doing before the illness crept in. People that had love, that had families, that had social lives, religious, spiritual lives. Look at people like that and then place a value on them, because if you place a value on people, it will show your behavior. People, it will show in the way you behave towards the people. Now, a quick one. I'm going to ask you this too, and I'll need, and I've not heard it. I want to hear the voice of everybody. I've actually taken note of the people that have responded so far, because I need, before we finish, I must hear the voices of everybody. I love to hear. I love to learn from people. So now, we want to look at these two scenarios. Remember, as a caregiver, you must respect and protect the dignity of your clients. Do not do anything that will make them feel less of a human being. Do not do anything that will make them belittle them, or will expose them to feeling less of themselves. This is not why you are a caregiver. So let's look at these two scenarios, please. I just need maybe perhaps a unanimous answer this time around because of our time. Oh, network has been dealing with me. Is Emmanuel Inspector. Sorry about that. Okay, Madam Yang Kusan, thank you. I really wanted to hear your voice. Caring Queen. Caring Queen, you are saying that you've not been seeing my screen. Is it so? That must be from your end. Because I guess I like to carry everybody along. So intermittently, I have to check the chat box to see who is having any challenge. Caring Queen, you are not seeing the screen. Please, can everybody see my screen? I need to know if the problem is from her end. Can everyone see the screen, please?
Yes, please.
Yes, we can see the screen.
Good evening, it's my Sebasti. I can see your screen.
Okay, because Caring Queen, I don't know, maybe you should turn on something must be wrong with your device because every other person can see my screen. Please, sorry about that. I'm just seeing your message. And thank you, Madam Kusan Niyang, for that answer that you just put. Okay, I was trying to say that someone should help us. It could be everybody answering. No problem, because we don't have too much of time left. So now these are two scenarios. We are talking about valuing people. We are talking about respecting your client. So these are two scenarios. Consider the two situations below that I have on the screen. Which caregiver is being more respectful? Now, caregiver A enters the client's room and politely tells them it's time for a bath. That is the first caregiver enters the room and tells the client or the patient that it's time to have a bath. And then caregiver B knocks on the client's door, waits for permission to enter, greets them politely, and offers choices on when to bath. Do you see? That actually the time that that caregiver is supposed to move around and ensure that the caregiver, that the clients all have their bath at that particular time. But because of this, let's look at the two. Remember, we said that sometimes you don't, and nobody will hold you responsible if your duty is not done. So far, you document and you take into consideration person-centered care. You allow the clients to have such choices. So in those two illustrations, please, I would like to know which one is more person-centered, which one shows that that client is actually valued. When we look at one of the concepts of person-centered care, is it A or B? Which one? Please,
Caregiver B.
Caregiver B.
Okay, caregiver B, thank you. So caregiver B knocks on the door. Remember, we need to be respectful. You knock on the door, you wait for permission to enter. You don't just open because the person will not be able to shout or do anything. You know, they are vulnerable. People that you take care of are actually vulnerable. So we would not take advantage of that. You still give them their respect, still show that they are humans, and be very careful as to how you reach these people. Don't forget, I said they are very sensitive people. People that are vulnerable are very sensitive. They mark everything you do. They misinterpret, they misconstrue if you don't do the things you have to do well. So caregiver B is actually valuing the individual, shows value because of the rest. Okay, let's move to the next one. Oh, I've not done too much today. All right, so now we want to look at person-centered language. Now, person-centered language, person-first language, I beg your pardon, under person-centered care. What is person-centered language? Our language matters. The way we refer or the way we talk about our clients that we are taking care of matters. In person-first language, the person is more important than their mental and physical condition. So you see, now let me explain. In caregiving, it is important to use person-first language. What does this mean exactly? Somebody may say, what is even this person-first language? Person-first language is a way of speaking and writing that puts the person before any condition or disability that they may have. It shows that you value the person. It shows that this person, number one, is a person. Dorothy, first and foremost, is a person wonderfully created by God before this challenge actually came in. So person-first language simply talks about rules of the person first language. Put the person first and the condition second. For example, I care that your language is very important. As you are talking, maybe you are dealing with someone that has dementia. Someone asks you, what do you do? I care for dementia patients, or I'm caring for a dementia patient. That particular statement, this particular statement I have made is not respectful. Let me just use it in the layman's language. It's not respectful. It doesn't show that you actually value that person. It doesn't show that you are actually conscious of the fact that that person, or the person actually has this dementia issue. Rather, you can say, I care for people, or I'm caring for a person that is experiencing dementia. That is mild. When it is said, it is mild. Even if a person hears, even if another person hears, it is mild. It's like you're pouring a cold water on top of something that is hot. It makes it, that is what it means. So our words, our language matters when we are dealing with these people that are actually having disabled, if we want the person first language, if that is most appropriate for us in our setting, then we should learn to use, to refer to the person first before we now talk about what the person is actually experiencing. That's person first language. Okay, another one is you describe the conditions as one and not defining the characteristics of a whole person. For instance, you say Michelle has diabetes. Michelle has diabetes. Do not say Michelle is a diabetic. Or some people say, oh, she's a diabetic patient. That is weighty, that is bad. That is inhuman to say in most cases. But again, before we talk about this, I want you to understand that it is not one size of a cap that fits all. No, it depends on, there are people that don't even like you to go this way, don't like this route, using the person first language. But by you using this person first language, you recognize and value the whole person. You emphasize their personhood above any healthcare challenge or needs that they may have. Very important. Okay, let me give you some other examples so you'll understand. Like instead of saying the wheelchair-bound individual, instead of you saying someone that maybe has disability, cannot walk, has mobility issues, and is bound on the wheelchair, instead of you saying the wheelchair-bound individual, you can decide to say the person, I'm dealing with a person, or that lady uses the wheelchair. You can say so instead of saying a wheelchair bound, because if you say wheelchair bound, you have attacked the particular problem, disability that the person has, and it's not mild anymore. It's going to be harsh when it gets to the person or it gets to another person. I don't know if you actually understand what I'm saying. I'm trying to come down to the barest level so we can just have a walkthrough on it as easy as possible. Or you have an autistic child, like autism, some children that have autism, and you're handling a child, maybe or a person with autism or an autistic child. Instead of you to say, this child is an autistic child, you can say the child has autism, or you can say, I am dealing with a child that has autism. It is mild than saying an autistic child, a dementia patient, and so on and so forth. So our language is very, very important. Why is it important? Why am I even really talking about this? It is important because let's see, maybe you are caring for an elderly gentleman named John. I like to use John. So I'm going to be using John more often as I progress. So now using person first language, you wouldn't refer to him as someone that has Parkinson's disease. No, you wouldn't do that, or a Parkinson's patient. You can't do that. Instead, you say, oh, this person is living with Parkinson's. Or John, oh, that's John. He has Parkinson's disease. It makes it mild. That way, someone knows that, oh, John, okay, John is first and foremost a person. Oh, this John, this important John, this intelligent John, oh, he has Parkinson's disease. So you see, the person is first and foremost placed before the disability. That is important for us to know. So let's see. Now, I want you to give me some answers to this. I want to know if you actually understood what I have said. So I'd like to have some answers to this. Oh, 6:31. Wow, 7. Okay, we would get there. All right, so we have some statements here, and I would like maybe someone to just help us to, based on what I have just said, that you emphasize the person as being important. So how can we rephrase this statement to be, using person first language? So let's look at it. You say Bill is disabled. Maybe we'll just take just 2 so that we can move, because time is going. So Bill is disabled. So someone should help us. How can we make this person first in person first language? How do we change it? Bill is disabled. So someone should help us. So we just move. So how do we change that?
Okay, can I try? You could say that the Bill is physically challenged.
Okay, let's take Madam Kusan. Please, can you help us? Help us so we don't have too many.
All right. So once when referring to the first one, Bill is a person with disability.
Okay.
And then
thank you so much. Thank you so much, Madam Kusan. I know why it's a walkthrough for you. I know the reason that I don't want to say. All right, thank you so much. Bill is a person with disability. Yes, please go ahead. Who is saying something?
Faith. My
Faith.
name is Faith.
Okay, Faith.
Yes.
Okay, Faith. Go ahead, Faith. Thank you.
Yes, when referring to somebody putting first name, we don't actually describe the person according to the situation, according to the problem. You can as well refer the person like Mr. So and so, or Mr. Bill is having a disabled, or him. You can put it like that.
Okay, thank you. Thank you so much. Thank you. At this point, I think we are trying to, because of our time, we are trying to understand. And thank you, Madam Kusan. And who just responded now? Faith. Thank you, Faith. So this is practically it. We should be mindful of the way we refer to these people when we deal with them. They are human beings, just like us, and we have to, anything in any way that will stand on the way, we should put it away. So we've talked about person first language. Like I told you, it depends on the scenario, it depends on the situation, it depends on where you find yourself. And the most important thing, and the bottom line is, you know what suits you. Like I said, it's not cast on concrete. It's not cast, all these things we are doing is not cast on concrete, because it's like someone giving you, telling you about how marriage is, you know, like I was told before I got married, marriage is this, is that, is that, is that, is that. But when I actually got into the marriage, I now saw that it was slightly different. It was exactly different from what I was told. Like I saw some things and experienced some things firsthand. So why am I using that illustration? It depends on the setting you find yourself. It depends on the person you are dealing with. That is why communication is important, and learning to know your client is very important, because there are some people that don't even like that person first language. That could be a problem when you deal with them using person first language, I must tell you. Then there are some people that will prefer this identity first language. So we are coming to that. This identity first language, what does it talk about? Now, okay, identity first language, like we have here, prefers, not everybody prefers person first language, like I said. Some people feel that their condition, some people, you cannot detach their condition from them. That is just the way they are. I have an uncle that is like that. That my uncle used to have, is asthmatic, yes. So anytime we talk about, he had asthma. So anytime it's cold, maybe cold season like this, where he had to use the Vicks and all those things. So when you tell him, uncle, okay, he will tell you, it's cold season again. I'm using, because you know me now, I am an asthmatic person. I'm asthmatic. You know me, I'm asthmatic. So me, in my normal way, I'll say, uncle. Why do you always like to say you're asthmatic? You are not asthmatic. Don't say that. You only have breathing challenges here and there, but you are not asthmatic like you're actually thinking. Anytime I tell him that, he will just laugh and say, why do you always like to paint something that is black, white? I said I have asthma, and I know that I have asthma. You are trying to paint. I already know I have asthma, so it's not a problem. So why did I bring you that scenario, because some people would not even feel, they cannot detach their condition from themselves. They feel that it is their identity, it's their signature, it's their ID. You understand? So when you even try to make it mild, they don't like it. They prefer that you attach their condition to them. It is part of them. So remember, we talked about the first one. So this one, examples of first language are, like you can say, like we said, it's just the opposite. I'm an autistic person, you know, handling patients with dementia and so on, dementia patient, diabetic patients, all those type of things. So it's just the exact opposite of the person-centered language. So why did we need to bring this? So that in any situation or scenario you find yourself that aligns with you, you would know the right thing to use. So now, we've talked about two. We've talked about valuing people. We've talked about learning to learn about people, those two. So now there's something we call recognizing the dignity of risk. Recognizing the dignity of risk. Most times as caregivers, you find out that your clients actually want to do the things that are risky to them. That's why they say recognizing the dignity of risk. Recognize that there is dignity in risk. That is what this is talking about. Now, what is important to them most times could be risky behaviors. There are people that I know of, my grandmother of blessed memory till she died. She was somebody that was used to taking sugar. She loved taking sugar. Even when she had issues that she was restricted not to take sugar. So it was a problem. Even the nanny we hired for her will always complain that if tea is made, my grandmother will insist that she puts the sugar herself. And you see, this is risky behavior. Yes, but there is something I want us to understand. That's why this slide is there. Now, you cannot force them to stop that risky behavior. You can't say from today, you are not taking, no, you take away the sugar, throw it away. You know how it can be when you're trying to help someone that is not willing to help himself or herself. You can imagine such a situation, you know. So what you can do, that's why the slide is here. Let them know that you are concerned about them. At no point should you forcefully carry out what you want on a client or a patient. That's the aspect I keep delving in, because we've had a lot of caregivers lose their job in just 1 minute mistake, you know, that they made. So in anything you do, recognize and understand that these people should have a 70% say in their lives. What you can do for them is to help them understand the importance of them not taking these risky decisions, not to stop them from taking it. For instance, now, okay, let's look at what we have. Let them know that you are concerned about them and remind them of your role and your responsibility as their caregiver. They are in control. Make them know that, but you care about their well-being. Let that be spelled out. And so if you care about their well-being, some risky behaviors, they should not be doing it. Let them understand the implication of these risky behaviors. And at no point should you superimpose, maybe one, smoking or something is not good to smoke, and you know that person is not good to smoke, you come pick away the cigarette, throw it away, collect. Why should you smoke? Or you do all the, you know how it can be when you are helping someone that doesn't want to help himself or herself. It can be frustrating at times, of course it can be. So, but as a caregiver, you know, you try to help. And then you work with a team. That's the beauty of it. You work with a team. You document. It's like the nurses do before you leave your shift. You document everything so that the care teams draw their attention to it, because so that you will not be the only one working on it. All fingers will be on deck. All the team members will work to see the best way to be able to handle that situation. It is far, far better than you superimposing what you think will be good for them against their will on them. Very important. Now, if the behaviors are more serious, document them like it's already here. Report to your supervisor or your case manager. Report. So if you work in a care home or a care institution, of course, you have supervisors. You have people in the hierarchy of the care team. Report to them. Let them know. They would, you understand, they will come and they'll do exactly what they are supposed to do. So like we have here, you can see examples of risky behaviors. You can see there's someone smoking. You can see elderly people. It's not, you can even see that man, the way he looks, you know, it's affecting him, you know, smoking, taking sugar, doing things that they were doing. Like I keep telling you, don't forget these people had their lives. And so sickness cannot all of a sudden just change them. Do what? No. It doesn't happen. Even you and I, we don't just change easily in a split second. So, but you make them understand that it is good for their health. And what I want to tell you is that if they genuinely, that I have proved and I have tested, if they genuinely understand why. If they genuinely understand and know why, so as I was saying, share with your clients why you are concerned. These are some of the things that you can do when there is, because of course you'll be faced with such situations. Share with them, let them understand why you are doing all the things you are doing. It's for their own good. Ask them if they are interested in discussing alternatives that may be better for them. Like that sugar I talked about my grandmother. At a point, we were like trying to, we looked with the medical team that we're actually handling her. We tried to see how to explore. We tried to see how, it's not traveling. We tried to see how to explore modalities to see whether we could find out any other way, something else, because we observed that she complained of the mouth being bitter, of the tongue being bitter, you know, so we look for other alternatives that could be, you know, that could work in place of the sugar. You know, that could work in place of the sugar for her, you know. So when you do these things, some alternatives. When you do some please, can we mute? That sound is actually interfering. So these are some of the things you can do, and you all right. So that being said, let's see what we have on the next slide. Celebrating cultural identity. Celebrating cultural identity. Okay, how do you celebrate? Celebrate cultural identity. Learn about people's culture and identity. Learning about them can tell you a whole lot about who they are and what they prefer. Now, for instance, talking about culture, there are some cultures that an elderly person, okay, it happens in different cultures. There are some cultures that when you talk to someone, a younger person, and the person looks you in the eye, gives you direct eye contact, maybe you are talking to your child, maybe reprimanding him or her for doing something wrong and talking to your child looks at you in the eyes, you perceive it as insulting. That's why I'm saying that our preferences, our cultural our identities are diverse. There's cultural diversity, and people are different. And there are some cultures that your elder talking to you and you don't look your elder in the face and in the eye shows that you are disrespectful. So you see, these are two schools of thought coming from two different areas. So people have different cultures, they have different identities now, and different religious beliefs. So as a caregiver, you must understand what your client actually stands for and what your client actually wants. A very quick one, I want to give you an illustration, something I heard some time ago in the internet, I think Facebook or so, that one of the one nurse, I think a nurse or so, a caregiver, was lost her job because of something. You see, she actually went to a hospice care home. That's where they take care of elderly people that are very old, that are just counting days. In fact, they just manage them for them to live the remaining of their days. You know that they don't have too long to stay. That section is called hospice care. So she was actually attached to the hospice care section, you know, taking care of such people. So she actually went into one of the rooms and met this elderly woman, this woman of 80, I think 87 or so years old. And because she loved the woman, maybe the woman painted a picture of her grandmother or something. So she loved the woman. She tried to do something. She was so happy. She prayed for the woman, you know. You know that immediately she finished praying for this woman and left, the woman's daughter came. She was like praying for her. Oh God, keep this woman, this beautiful woman, let her live longer, and so on and so forth. When the daughter came, you know, that was the singular act that made her lose her job. Why? Because she did not learn enough about the people she catered that she was looking after. She did not learn about them. She didn't know about them. People have their beliefs. Just that act of when the daughter came, the mother explained that one of the ladies that came around, the caregivers, the nurse prayed for her, you know, oh, Just that act, the lady left there straight to the office and reported her instantly. I don't mean something they say, let us do this. Instantly, she was relieved of her duties because of something she did that was good. But in this part of the world, like me, if I have a mother that someone comes and prays for, I'll be happy. Oh, wow, what a lovely person to pray for my mother. I'll be so happy. But the reverse was the case. Why? Because she did not understand their culture. She didn't understand that their own cultural beliefs was the opposite of hers, and she shouldn't impose hers on the woman in a bid of trying to do something good. So these are things we should honor people's preferences, support their choices, and then know them well enough as to know what to do and to draw the line when we should. Supporting people, to think of supporting a client and working with him. Work in partnership with your clients. Don't take unilateral decisions. Make sure that your client is in control of his or her life. There's nothing that gives us, imagine even you and I talking, the things you used to be in control of, all of a sudden you are deprived of all those things. It doesn't work out well. It won't even help you. It won't contribute positively to your well-being. So that is how it is for them. Whatever they do, activities of daily living, only assist, only support, know the extent you can go. Notice, find out from your service plan what you actually need. Do they need whole support? As we go on, subsequent days, we'll get to see the different types of support we can render to our clients. So if you are just to give minimal support, like the hands are okay, that person can actually wear the clothes. All you need to do is just to maybe hold the hands to the buttons and assist the person to button up the clothes. And the one that cannot do at all, okay, my duties involve actually practically wearing the clothes with the assistance of the person. All these things are things that we need to understand. So we promote choice, direction, and control that I've already talked about. Let them have control over their own lives. Positive effects on their well-being, because when they have control, it helps them. Your duty there is to help that person to recuperate, help the person to get out of that state, help the person to do better. That is the essence you are there. So anything and everything that you could do to ensure that that person gets better is something that is worth doing as a person-centered caregiver. Now, as you get to know the person you support, you will learn their daily routines, like I talked about. You learn their preferences. You learn the things they want, the things they don't want. You see the things they love, the things that light up, that put a glimpse of light up their eyes, the things they really love to do, the things you can help them to do so that they can get better. All these things are things that you have to do. So you see that a caregiving duty is not a walk in the park. It's not very easy, but it is important that you learn all the tricks and the tips that you need to know, especially if you want to be a professional caregiver. Okay, now there is something else that I would like to throw open for us. From now on, we'll move a little bit faster because we've really dealt so that we'll be able to meet up at least 8:30. I had already craved your indulgence that today we are certainly going to exceed 8 o'clock because one, we had some network issues, and I want you to get total value for your money and to actually understand what we are doing today. So on this slide, please, once again, I throw it open to the house. What do you think? Which one do you think is preferable from everything we have talked about, supporting your clients and so on, person-centered? Which one is better? Mrs. Cortez likes to dress for supper and is particular about her appearance. The blouse she would like to wear is wrinkled and she would like you to iron it, but she's already running very late, which is a more person-centered approach. Now, choice A, let her know there is not enough time and ask her to please select another blouse. B, offer to iron her blouse, but suggest that it might make her very late to supper. Which of these two is more person-centered? The place open. Pardon? Okay, B. All right, thank you. Who answered, please? Because I said the people that have not answered me, I'm going to be on their neck. Who just answered the B?
I answered B. My name is Idara.
Yes. Idara, okay. Okay, so many people answered B. Mr. Dayo. Mr. Dayo.
Yes.
Mr. Dayo, please, I don't know. Are you Mr. Adedayo?
Adedayo, yeah, Mr. Adedayo.
Okay, you were the one with the challenge, I guess, initially.
Yes.
Oh, I'm sorry. I apologize. I'm really sorry. At the end of this, I'm going to add you to the group. The reason
No
I did
problem.
not add you, I don't know, because I actually placed the list on the general group for everybody to check. So maybe there's a mix-up. There was a mix-up somewhere. I really apologize.
It's
Sorry
all right.
about that.
No problem.
Welcome joining us. Okay. So choice B is actually the best because it's person-centered, because you offer. An offer is something that is at the discretion of the person you are offering to choose. So you've given the first one said, you just said there is not enough time, and you ask the person, please, there's no time. You are not wearing this blouse again, pick another blouse. So we move. You know, that one, no. But this one, you offer to iron the blouse, but you suggested that if I iron this blouse, it will take late. You will be late for supper, or at least let her know. So that one is more person-centered. So let's move to the next slide. Good. So we are also looking at self-determination, self-direction, autonomy, and independence. Now, this cannot be overlooked. It's part of what we already talked about. Now, supporting a client's ability to be independent is very important. Each client needs different kinds and levels of support. Like I said, eventually we'll get to look at the levels of support that you can provide. Now, consider the difference between you buttoning a client's shirts for them and helping to steady their hands so they can fasten the buttons themselves. You see, sometimes you may just want to, okay, this person is ill. Oh, no, let me just do everything. Wear your shoe, wear your dress, do this, do that. If you do that, you are taking away that person's autonomy. You are taking away the person's independence, especially when the person still has, to an extent, is still able to do some of these things. It's better if a person cannot even do it at all. But if your care plan limits you to doing some things, then I think, okay, thank you. I can see so many answers in the chat box. Thank you so much. I didn't check as of then. So consider that there are two different things. So if you want to do everything, okay, wear your blouse. This is the shirt I want you to wear. We are going out right now. Put on the shirt. Do. You will not get the best. And of course, nobody works in an atmosphere that is not friendly. If you are not happy doing what you do, you cannot last in where you are. It's a simple thing. So that is why you have to be happy. You have to derive joy in doing it. Just like what I tell teachers anytime I go for teaching seminar, when I have early childhood education or I have any, I tell them that if you are not happy in what you are doing, please leave. Because teaching children is a strategic job. Teaching children, you have to do it with passion. You have to do it with happiness. If not, I tell you, you will not succeed. So just do it with happiness and move. When you do it with happiness, you find out that you sleep every day and dream of being in the classroom. You sleep and dream of these children do their little things. You look at their idiosyncrasies and you look at those things and it makes you happy because you derive joy in doing it. So these are some of the things. So you just follow your care plan and understand when you need to support your clients and when you don't need to go extra mile. You have to allow your clients to also participate in doing his or her own thing. There are things that are personal to us. Oh, this training is just going to, is packed. I'm not trying to blow my trumpet, but you will testify at the end of it. As time goes on, you would see that there are things that people personally love to do themselves, like we are here. Of course, there are things that are personal to you that you love to do yourself. That because of sickness, you cannot do it by yourself. It's just like an elderly, a lady, a woman that is naturally, you have your privacy, you dress yourself, you do everything, and all of a sudden a stranger from nowhere because of the illness now has to come and do these things for you. Oh, it takes a whole lot. It takes a whole lot for you to give in. So if you understand these things, it will be easier for you to handle these people and understand when they put up their challenging behaviors that it is not them speaking, but it is the challenge they have that is actually speaking. So let's move to the next slide. I like to do a lot of talking. I don't know why, maybe because I've been a teacher, so forgive me. I talk so you'll actually understand what we are looking at this point. So right now, we want to look at power over. As a caregiver, there are things, there's something you need to understand. Like we're talking about, allow a client to have a level of independence. There's what we call power over and power with, two different things. And I'm going to briefly explain this concept to you. Power over is the practice of see fit. That's power over. I have power over you. Like some, not, I know it's not the men on this platform, we have some men that say that I paid your dowry, I have power over you, or this and that, power over, exercising authority. That is power over. To hold the authority and the control. You can shout, you can scold, you can do as you. It's time to eat, you have to eat. It's time to bed, you have to bed. It's time to do this, you have to stand up. No, I'm not interested. This is the time. In fact, this is my shift. I'm moving to the next, to attend to the next person in the next room. I don't have the time to, that is power over. And it is very natural for you to want to fix things for people that have issues with activities of daily living. It's natural. But try to resist that urge to do so without asking. Very important. Allow them to feel loved. Give them the autonomy. In this power over, the caregiver is the expert who knows what's best and makes decisions on behalf of the care recipient, which is wrong. It is very wrong for a caregiver to exercise power over the client, especially because you know that the client is having.
Yes. They didn't write anything about discharge. That'll be tomorrow.
Excuse me. Please help us to mute. Thank you so much. So, as I was saying, now, for example, imagine a caregiver who tells the person they are caring for, you need to take your medication at this time, and you need to eat this meal that I've prepared for you. I took time to prepare this meal, and I don't want any excuse. You need to eat this meal. All this is power over. The caregiver is exercising power over the care recipient, dictating what they should do, which is a capital no. It's a no. For any caregiving setting, it's a no, especially when you have to go out there. If you are exercising power over a client, you are certainly bound to have to face issues. Now, let's look at the beautiful side, power with. Every caregiver needs to align to exercise power with. A husband and a wife should exercise power with. Thus, the wife should exercise power with the husband in order to perfect things that has got to do with family. Power with is a mild way of you not exercising your authority. So when you exercise power with your client, it means that you support your client's autonomy. You understand that your client is an independent person. You understand that, yes, they would like assistance, but you have to make sure that you know how much assistance, what kind of assistance will they need and how much? And of course, what kind of assistance? Would they need me to practically get their shoes and help them to buckle the shoes? Or would they just need me to bring the shoes and they wear the shoes themselves? Or they just need me to gently support them in putting their legs in the shoes? You need to know what kind of assistance you have to. Try not to think about sharing responsibilities as allowing or letting the client do something. Power with is client-directed teamwork and decision-making. That is the difference between the two. The caregiver is involving the care recipients in the decision-making process.
Sorry,
acknowledging their autonomy.
Sorry, can you come back again? That power with.
Pardon?
The power with, not power over, the second one.
Okay. What I'm saying is power over, you understand that exercising your own decisions, superimposing, like forcing someone to do something against their will. Try to resist that urge, because if someone is weak, cannot do it, it is tempting that you may want to say, I have time to, okay, let me help her do this so that I can be fast and move on. It's actually temptation. Most caregivers do that, but it's not good to do it. But power with means you supporting your client's autonomy and independence, asking them if they would like assistance. That's to say that if you're a caregiver and you are handling someone, you ask the person, you don't force, okay, it's time for you to take your drugs. Would you like to take your drugs now, or would you prefer to do that later? Allow the person to have control at all times over his or her own life. Remember, we talked about the power, the exercising risk. Oh, I forgot that part. We talked about it. So even when it is something that is not good, follow the due process to explain. Let the clients know why it shouldn't be like that. So it is important that as caregivers, we exercise power with that, work side by side with. Find out what they want. Let your client be the one to speak to say what they want. Explain to them how you want something, understand from them how they want something done for them. You understand? If they need assistance, how much assistance do they need? What do they need you to do? All these things. Exercising power with. You are working side by side with. Working together with the care recipient to exercise authority. Would you like to take it now? Would you prefer to wait a little bit? These are things that we are asking this question so that your clients will still feel, okay, so I'm still important. Okay, no, I don't think I should take it now. I don't think I will take it now. Please, can I take it like some minutes later? Or would it be fine if I would like to take it by 5, instead of, okay, it's time to take your drugs, take your drugs. That's power over. It's time to do this, do this. No, you don't even want to know how the client feels. You don't even know if it is in order with what he or she wants to do at that particular time. You are just treating the person, even as a baby, you don't even do that. Because even babies now have exercise, they have their own independence, You don't just force them to do. So don't capitalize on the state, that their state of vulnerability, to superimpose your decisions on them without seeking their due consent. So that's what I mean, ma'am. Did you get that, please?
Yeah, thank you.
Okay, so let's move. Let's move. I'm trying to be fast so we can. So now, setting teamwork too, as you are part of a team that works together, like I already said. So at no point should you, or at no time should you decide to do things on your own. Work with your team. It will be your responsibility to know and work with your client's team. Like I said, you involve the family. Caregivers work with their heart. You work with the family. You don't only work with that person, because the family, they see you as the closest to the person you are taking care of. A client than a nurse. You are closer to a client than a medical doctor. You are closer to a client than a certified nurse. As your own duty is a specialized one. Your own is emotionally intertwined. That's when you can even exceed certain limits, in order to ensure that your client's well-being is important, because that should be of paramount interest to you. Okay, tailoring your care. We've talked about the person-centered care. We suggest that you care practice individuals' needs and preferences. Like I already said, different people. I may be handling someone with dementia, may be handling maybe someone with Alzheimer's disease. Of course, our line of duties will not be the same. So you tailor your care, person-centered, in a way that it will align with the particular challenge that your client is having. What is working for you might not be working for me. You understand? So adapt your care needs. Adapt your duties to align with your client's needs and preferences. Because even then, you have to be observant, because sometimes people's preferences change. It's not cast on concrete. So you have to really be on top of your game to function effectively as a caregiver. Okay, advocating for the person. Good. This is another point. As a caregiver, one of your duties is the duty of advocating. You advocate for your client. You spend a lot of time with your client. Like I said, you are closest to your client than all these other extended medical practitioners surrounding them. So you have a very important role to play. Encourage your client to self-advocate for quality. Whatever he or she needs, let him, help your client. Like in UK, outside as caregivers, you discover that the government themselves take care of elderly people. So most of these care institutions and care homes, they make things available, they provide for them, they ensure that they have what they need. So even as a caregiver, you are in the right position to actually structure your care to the extent of you being able to decipher and know when your client actually needs to speak out when there's any challenge. Advocate on their behalf. As we go ahead, you would see that there are times you as a caregiver, you find out that your client is being abused, maybe sexually abused, maybe abused by the children, financially abused, and all these things. So these are some of the things that you, because of the fact that you are closest to this person, you observe all those loopholes, you observe all those things, or maybe you observe the marks, or you observe the mood swings whenever that particular person that comes in, you observe a whole lot of things. So the duty of a caregiver is very, very broad. You help to control health services. You understand? Where you make sure that your client also gets in the community, interact, the things he or she used to value doing, social life, in as much as possible. Let your client still get involved in what he or she used to do with your supervision. So these are some of the things. Honoring differences, respect your client's culture, your background, and individuality. Most of these things are intertwined. So you may see them come up again. If you see anything, any term repeats itself, understand that it is very, we've talked about something, you see it play out again, then you know that it's very important. You understand? So honoring differences means respecting culture, background, and aware of their own biases and take action to the person. You have to do away with biases. For instance, maybe I am a black, let's say black, let me use that word. And I'm assigned to take care of a white person, or rather maybe vice versa. I am a white caregiver, that's you understand? And maybe a white a caregiver. So I'm assigned to take care of a black person. As I was saying, that sometimes you get so as I was saying, before you can honor and respect a client's identity, you need to be aware of how your own background and your own life experiences shape your view, your own view. Like I was saying, that our backgrounds and our life experience really shape us and make us who we are today. Before you see a person behave anyhow, you see, you know that people's life experiences really shape them. You understand? So it goes a long way. There's no time, but I would have given you a scenario of a friend that I had. Whenever she comes around and sees how close I am with my mother, how we run around and play and run around on the carpet, she wondered, she said, what kind of, me? I can never do this. So my mother that never stayed with me, I never had any rapport with my mother. Kai, I don't know how you do this. So I always feel so sad whenever I come to your house. And because of that, she cannot even form relationships. She's not able to trust people because of what she went through in her life. So why am I using this illustration? The things we pass through actually affect us. So if we are able to understand our own lives, it is easier for us to be able to understand another person's life. It's easier for us to be able to understand that the people we take care of have their own individuality too. They have their own different perspectives. And as such, we should respect them regardless of how we feel. Even if they are in opposite direction with us, we should ensure that we give them that respect that they deserve. So get to know your clients. We cannot overflock that. Know your clients, understand your client, learn more about them, ask them questions, ask the members of the care team. You can ask the family members, how was this person? What did this person really do when she was young? Because I find out that anytime I talk about school, or anytime I talk about a particular thing, I see that her eyes light up. You know, so what was she really doing? So when you know the people that you work for, it is easier. It's just like when you understand anybody aside the caregiving scenario, you are a woman, you understand your husband, it is easier for you to penetrate once you understand him. You know what he likes, you know what he doesn't like. Vice versa, a man, you know what your wife likes and you know what she doesn't like. When once you know a person very well, you have less issues. You have less issues, you know. So that is just the way it is. So let's go. Let's move to the next. Biases. Yes, we talked about biases. Now, in terms of biases, we already know what biases are. There are some things that we actually bring with us in our lives. They just come naturally. Those are biases. Like you just, let me put it this way. Biases refers to the tendency to make judgments or decisions based on preconceived notions. Sometimes we just think that certain things are like this. We just have that preconceived notion. We just believe that, okay, it is like this. It's like somebody saying, hey, I'm going to the clinic now. Maybe a woman that is about to put, a woman that is pregnant, maybe going for antenatal. And I'm talking about biases now. You just feel in your mind that, oh, this clinic I'm going today, I'm going to the clinic today. The doctor is going to be a female. That's it. That one is just a natural instinct. You just assume, you know, preconceived notion that, oh, okay, as I'm going today, they're going to check me. You know, women that are put to bed understand what I'm talking about. They're going to ask me to do this. I'm going to go and meet a female. I'm going to go and meet a lady doctor, a doctor there. You know, these are some biases, there are conceptions that you have preconceived and you don't have any bearing for actually conceiving them. Sometimes they can be positive, sometimes they can be negative. Now, let us look at Your reactions and your feelings towards other people, especially people who are different from you, happen automatically based on beliefs and values, your cultures, your environment, and life experiences. Already, some of us can relate to this. There are people that you naturally don't like, not because you don't like their person, but you already have conceived that maybe there's something you heard that they do, or there's something that they did to somebody that you know, or there's something I did to somebody that knew the person that you know. Naturally, they are stuck to us as human beings. So as a caregiver, you have to do away with all these biases that come as a result of maybe your environment, your culture, your life experiences, and maybe so we have different types of biases. We have the explicit bias and we have the implicit bias. The explicit bias, you can understand it, maybe like I talked about black and white. A dark person, maybe black. There can be issues of bias. We've had issues even on internet whereby the blacks are treated somehow, black this and black. I don't want to say those words here. You know, just because they already are racist and they have that issue. So in such situations, you don't take with you as a caregiver, you take with all those biases. You do away with them. Racism, comments that maybe you have heard, oh, black people, they're always doing like this, oh, they always treat like this, oh, they always, you know, you do away with all those things, because just go on a neutral and on a blank slate if you are going to be a caregiver. If you are a professional one at that, you have to go do away with all these biases. Now, what are implicit biases? Now, for instance, now, I don't know, I give an example of explicit bias. Sometimes religion, you know, recipient's race, the person you are taking care of, maybe the race you don't like is from here, or the person is this religion, I am that religion. If you have those biases, you will not be able to break the barrier and attend fully and give support that you need to give to this particular client. Those things will come in between your way. Now, implicit biases are unconscious. We are not really aware of it. Most times we are aware of implicit biases, like I talked about, going for antenatal and assuming that you go and meet a female in your mind. Okay, just assume it's going to be a woman. Now, you know, I'm a woman and I'm going for checkup and all those things. But most times you go there and you end up, it's not a woman, it's a man. So implicit biases are now communication. Very important, not only in caregiving. I think we've had a network glitch. Thank God network has favored us since. So are we together? I think we just had a little network glitch and
Yes, we can hear you.
Okay, screen is loading, load. Okay, thank you. Okay, so as I was saying, it is important that wow, Charity. It's nice to see you. I can see your face, Charity. Okay, so we're talking about communication. Communication is more than a verbal exchange. It involves values, you know, attitudes, actions, relationships, a whole lot. Communication is very, very broad. As a caregiver, you must understand how to communicate. You must understand the importance of effective communication, because like I told you, everything in caregiving surrounds, communication is intertwined in everything you do in caregiving. You have to learn, have the ability to listen, pay attention, listen, because listening itself is a powerful caregiving technique. There's a difference between hearing and listening. Hearing is just because, like if I bang this table, you can hear that sound I just made. You have heard it because of where your ear is, like you are with me. So you have heard that bang. That is hearing. But listening is a calculated attempt. It's something that you do with effort. It's something that you put in effort to understand. It's a calculated attempt. So as a caregiver, you have to be open to new ideas. Maintain an attitude of respect at all times. See things from a different point of view. Don't be stereotyped on, I want it this way, this is how it is done. No. Loosen up and be open to people's views, people's suggestions. Listen to your client. Becoming a good listener takes effort, like I said. It takes effort. It takes hard work for you to be able to listen and understand what someone really wants, especially a person that is vulnerable, that has a challenge. Now, active listening is a way of communicating that focuses on the message and feelings of the other person. Do you just listen for listening's sake? Or do you listen to connect with the person talking? Do you listen to understand the person's message? Do you recognize what the person wants you to do? Do you show and receive respect? These are things that you put together when you are listening. Like a child that the mother is scolding, maybe the mother just finished and the mommy says, go and get me that cup. And have you heard what I said? Yes, mommy. You see, that is a different form of listening. But a person that is in a right frame of mind, that pays attention, that makes a serious effort to hear what you are saying, understand, okay, what do you need me to do? Understand all your communication techniques, both the ones they can see and the ones that they cannot see. So it's important that we listen actively. Now, on this slide, there are 7 keys to becoming an effective active listener that you are going to see here. Eventually, we are going to take time when you get the slides and look at them. Be patient and respectful. Watch your own emotions. Give the person your full attention. You know, don't bring your emotions. If your husband did not give you feeding money, I mean, you had issues with your husband, don't bring it to the caregiving setting. Do away with your biases. Do away with your, don't transfer aggression. That's why caregivers, I tell caregivers that you have to do away with the fact that you're mental. Do away with it. Once you go into caregiving profession, do away with temper issues because you don't need it there, so you don't get into trouble, you know, so that you can function well. So these are ways you can understand what your client is saying. Even when the client has said something, please, can you help me with this? Or I want you to give me my food. I want you to do this. Restate it in your own words. Oh, please, did you mean I should get you your food? That's restating it. Clarify, ask questions, get more information before you eventually do something. I can see we were 20 and some people are actually leaving the class. It's not yet 8 o'clock, so it's almost 8 o'clock, but I have told you that today, just today, please, I plead that you allow us exceed 8 o'clock so we can complete. So you see, clarify what the person is saying, validate. If the person is upset, use your own words to acknowledge their feelings. Oh, it sounds like you are frustrated. It sounds like you couldn't really get what I was saying. You know, restate the person's feelings. That way, you will understand better what the person wants. As you can see, this is non-verbal expression. You see elderly people, you see caregivers, all those things mean different things. They mean different things, like you can see that woman there. You see, she's trying to send a signal. So, like I said, what is what doing is what doing well. I just want one person that has been nice enough to still remain on the platform, not to have exited, to tell us, what do you think, just in a sentence, what is happening to the woman in white? What do you think is happening to the woman in white? That's non-verbal. She's not saying anything, but if you are a caregiver and you see your client doing that, what immediately comes to your mind? Who can help us? Just one sentence, please.
I think she want to sleep.
Okay, pardon, she wants to?
Sleep.
Okay, she wants to sleep.
Yes.
Okay, that's what you heard. That's the woman in white. Okay, she wants to sleep. That's a good trial.
Can I say something?
Yes, please. Who is talking?
It's Joy.
Okay, Joy. All right, thank you, Joy.
Let's assume the woman has schizophrenia. So maybe she's trying to check the time.
Okay, thank you. She's trying to check the time. All right. Who has something slightly different? Everything, all these comments are, all the
You
answers are.
you said she's non-verbal, right?
Yes, non-verbal expressions. Like non-verbal expressions are those things that are not said. That she's not saying what her problem is. Go ahead. Yeah.
If I meet somebody like this and I don't understand the meaning of whatever she's doing, and I have the ability of sign, I can still give the person sign to see if I can communicate.
Okay, thank you.
Like
Thank
sign
you so
language.
much. Okay, I understand what you mean. That's using another method of communication.
Yes.
Okay, there's still, we've all given very good and excellent answers. But as a caregiver, if you see someone like this, okay, let's look at this woman now. What does this picture tell you as a caregiver if you see your clients like this? Who will help us? Charity, I would love you to say something so I can hear your voice. What does it look like? Maybe your mother, your elderly mother, or someone you walk into her sitting like that and you are the caregiver. What do you think is going through her mind? What do you think is the problem? Since she's not able to express herself verbally. So what do you think? Charity, can you help us?
Okay, ma, I think she's worried or thinking about something.
Okay.
Yes.
All
Maybe
right.
she's
Thank you so much. Thank you. That's why I said. Good. So this particular picture looks like how I told you my mother-in-law used to sit whenever she doesn't have money. She'll sit like that and put her hand there. She's worried because the last money she has is finished. So sometimes as caregivers, thank you for the wonderful contributions, Joy, and everyone has contributed. Sometimes these elderly people are not actually able to express how they feel. That's why it's important for us to observe, learn their non-verbal expressions. Like the woman on the left could be, well, yeah, someone said checking the time, it could look like that. But most importantly, I think she's she's holding her hand. It's either she's feeling pains on her wrist, or maybe she's not feeling any sign of blood on her. I mean, the woman in white. So she's trying to like, I'm not feeling anything, or she's feeling pains. That's what she's trying. The other woman, obviously, the picture shows that she's looking worried. She's worrying about something, maybe her children, maybe she doesn't have enough money. Maybe, oh, why am I like this? What is happening to me? Am I just going to come and sit like this and remain like this for the rest of my life? Certainly, she is worried. That facial expression shows that she is worried. So thank you for all the contributions. Let us move. We just have a few slides and then we are done for the day. So we should learn to recognize non-verbal expressions. Like we said, non-verbal communications. When we see them, we should understand them, what they mean, and what it actually stands for. I don't intend for us to exceed 8:30 on this. So please bear with me. We should be done before 8:30. We should be rounding up. So non-verbal communications, it includes tone of voice, facial expression, the posture, body movement, and a whole lot. Anything that is not spoken out is non-verbal. Some people may avoid a subject because it's embarrassing or it's difficult for them to talk about. So they prefer to show you the sign. They prefer that they do so it's difficult for them to make a verbal communication because they are embarrassed about the situation. They're embarrassed about what is happening to them. Like some, maybe they have, there's someone I know that used to have urinary incontinence, maybe because of how she is and all that. Sometimes urine leaks out in the care when you take care of her. So she's always afraid. She wouldn't be able to tell you. She will just shrink, and you see, facially, you see that there's something wrong with her. You now, so you will understand that maybe that she has maybe urine has leaked out as usual up on the bed. You know, so some things are embarrassing for some of these people to really talk. So as a caregiver, you have to explore all avenues to learn what they want. Signs of confusion, you have to try to learn when they show you when they are agitated. Physically, they can be shifting their feet. You know, they can be withdrawn. Maybe those of them passing through things, they could have behavioral issues. They can be withdrawn. They can be nervous. They can be inattentive. They can be upset. You know, some of them, there are so many issues that happen, you know, that caregivers see on daily basis, different things. So it's important for you to be well-grounded so that you know exactly what to do. Listen with empathy, whatever, at any point, listen with empathy. empathize with them. Let them know that you feel what they are actually going through. Let them know that you value them as humans. Let them know that you respect them, that you value them as humans. Let them know they have a shoulder to lean on. Let them know that you actually are concerned about their well-being. And with that, it's easier for them to relate. Feel their emotions because you are a human being. Aside the money, let's keep those just aside this time. Let's shift it. Let's first look at them being human beings. You listen with empathy. You listen to them. You feel their emotions. You understand entirely from their point of view where they are coming from. Do not be judgmental. Do not want to give them your own advice. No, that cannot help them. But when people know that you listen to them and you understand how they feel, their experience will help you develop. When you do that, it helps you develop that bond with them, and they learn to trust you more. They learn to connect with you emotionally more. They can tell you no matter what. And when they tell you what their challenges are, it's going to be easier for you in your caregiving journey. That's what I want us to understand. So we are almost there. Okay, for instance, now, I would have said, let me throw this open, but let me talk about it because of our time. Now, Jesse says, I do not like my neighbor. His dog barks all day and his front yard is a mess. You understand? So the response, conversation A, that's terrible. Why don't you go tell him how you feel? Maybe he will take care of it. That's conversation A. Then Louis says, the food here is terrible. I cannot eat what I want. And Idrissa answers, that sounds frustrating. Remember, we are saying feel the emotions of your client. Show empathy. Understand that this person is feeling like this because of this. That's very important in caregiving. For instance, this one just says, that's terrible. Or why don't you go and tell him how you feel? Maybe he will take care of it. But this one says, after hearing what Louis said, this one says, that sounds frustrating. That's to say, oh, I feel your pain. I can imagine if it happens to me, oh God, why? You know, that must take the enjoyment out of dinner time. So quickly, before I move to the next slide, in those two, which one do you think shows more empathy? Which one do you think is more relatable to this scenario? Which one? Pardon?
Can you hear me?
Yes, I'm trying to hear. Pardon, you say?
It's B, this second scenario.
Thank you, B. Okay, please, do we all, because I'm hearing the voice of a gentleman, do we all agree that conversation B is the correct one? Please, I need a unanimous answer, please.
Yes, I agree.
Okay. Thank you.
Yes,
Just one man.
conversation B is correct.
Okay, thank you. At least I'm happy I've heard a man's voice, men voices, and I've heard a lady's voice. Okay, let's not be tired. We are almost done. What is worth doing is actually worth doing well. So conversation B expresses the emotions, tells the person that I can feel your pain. That is what a caregiver should do. Let your client know that, yes, I understand how you feel. And it's just okay because everybody passes through it. When you make them know this thing, they're easily thrown to coming all out to let you understand, you know, to make your job easier for you. Let me just say so. So managing your communication too, how we communicate through our body language is the result of habits that we formed over time. So we should learn to keep our tone of voice in check, because some of us, when we are angry, we cannot hide it. Before you know, it shows in our tone of voice. And of course, when you are working and you are handling a vulnerable person, anger should not come into play. That's important for us to know. So our body language, hissing, snapping our feet, doing certain things, gestures that we have built over time as personal individuals, even though we've turned caregivers, as personal individuals, we should not allow them to interfere with our relationship with our clients. Put them all away. Throw them away. Try to handle some of these emotions. When you come, wake up every day as a caregiver, happy. When we get to caregivers and their responsibilities or self-care for caregivers, we would explain. So far, I've been talking about clients. When we get to caregivers, you'll also see how best you can take care of yourself. So becoming more self-aware of your body language and tone is the first step in identifying and improving your communication habits. If you are used to certain habits that show when you are angry, please put them away. There are different types of expressions, like you can see there. You can see somebody, two hands, you can see that man is the two hands on his head and the other person sitting like that. There are different expressions showing different things. So as a caregiver, you should understand these things. When you see, your client gestures, postures, facial expressions, body language, all these things are very important. As you deal with clients, you observe them and you also watch your own as well, so that you still fit, act professionally in your field of work. Now, effective use of spoken words. Think about what you want to say before you say. Important. Use simple words and common terms that you are sure the other person understands. Don't speak in ambiguity. Don't speak, let your words not be ambiguous. Let there be words, let there be things that easily the person can understand. Avoid using slangs, words, or swearing, all these type of slangs and all that. You are in a professional setting. So filter your words, make one point at a time. Clearly pronounce each word without mumbling. These are things that are very, very important that we have to take note. Match your body language with what you say, because as I told you, if you have old people like grandmothers, grandfathers, elderly people, you understand that those people read everything. They read, and let alone that they are having challenges. There's how you can even do something. They will say you snapped at them, or you hissed, or you moved away, or you are not happy about what you are doing. Oh, I was, a whole lot. So keep your emotions in check. Very important. Communicate in ways that work best for your clients. Over time, knowing your clients, supporting them, valuing them, you must have known the best communication methods that you can align and work with your client. So you should be able to know how best you can communicate. Try, keep trying. It's a school. When you are a caregiver, you learn every day. Keep trying, keep trying. And at a point, you will just get there. There are barriers to effective communication. Environmental barriers, communicating through mask, conversational bad habits, ways people talk. There are people that already have bad habits. They don't know how to facilitate a smooth conversation. There will always be problem. Imposing your point of view, advising, avoiding. At this point now, I want to pause now. Just have, I think, 4 slides to go. Just 4 and we're done. Look at this picture. I want us to look at this picture. Look at the caregiver, look at the man. One sentence, please, because of our time. Can someone just say what is actually playing out there? What do you think is happening there? What is the caregiver doing, and how is the person feeling?
I think he's cold.
Yeah.
It
Okay,
looks
please,
like
who wants to speak?
it looks like he's scolding him.
Yes, yes.
Okay, thank you. Thank you. Looks like he's scolding. You can see that temper can come into care, because why? Because caregivers too are also human beings. They didn't fall from planets, from another planet. They are human beings as well. So that means you have emotions. But it is important that you keep your emotions in check. You can see that guy, that caregiver there, is scolding the client. Probably, maybe he wants him to do something that he doesn't want to do, or probably they have some disagreement. There's a clash in the line of their duties. And you can see that man, the client is just withdrawn, and he's seated there, he's just withdrawn. And from that facial expression, so many things will be going on in his life. Perhaps he'll be saying, oh, if not that I'm like this. You see what life has turned me into. Someone can just shout at, a young guy, a young person can just talk to me, and you can never know what is going on in that man's mind. But obviously from that picture, you can see that the caregiver is not happy. He's like in his worst moment, so he's like trying to scold, point at, talking. And most times it may even be something that would have been for the good of the client, but you don't go that route, because when we get to caregivers' rights, we are going to see clients' rights. You would see that they actually have their rights. And anybody walking in to see you in this state with a caregiver, with a client, it boils down to something. So we have to really be careful, especially if you have to go out. It's better you do the unpaid one with your grandmother or around. But if you have to really do professionally, we have to be careful. There are ways you can navigate these challenging behaviors. Stop yourself from reacting with negativity when you see such things, just like what we just saw. Stop yourself from going overboard to react with negativity, maybe showing your talents. We all have talents. When we are angry, we bring them out. We don't waste time to bring them out. But in such settings, we have to be careful. Stop yourself from reacting with negativity, no matter how much tempted you are. Get calm and balanced. You can breathe deep in and out. Breathe in and out. Take a deep breath. By the time you are done with breathing in and out, you will be relaxed. Make a conscious choice of how you want to respond. Do not respond at the spur of the moment. I tell people, when you are angry, any comments you make when you are angry doesn't always turn out well. That's what I have come to know, and I've learned it over the years. So when you are angry, just try to allow that moment pass. You can count 1 to 10 and see how to do away with the anger. Then you take your time, make a conscious effort on how you would want to respond to any challenge that you find yourself. You see, dealing with specific challenging behaviors, like you can see what is happening there. I don't need to ask because our time, I want us to finish before 3:30 and we are almost hitting the target or slightly above. So you see that man and that, you can see another thing, shouting. You can see the elderly man, you can see the patient, the client, with all eyes open, mouth, with all, such situation is uncalled for. If you are a good caregiver, if you're an excellent caregiver that wants to carve a niche for yourself in the caregiving world, learning with all the skills that you have learned, it shouldn't come to this. There's no point that you should be this angry as to bring out the beast in a person that is already vulnerable. What do you hope to achieve? So these are some of the things. And some of these things could be caused when once you understand, like I said, you understand well that these things is caused by the illness. Most of them, naturally, they are not like that. You will agree with me. It's because of the challenge that they have. It makes them to be angry easily. It makes them, some of them, violent. Some of them even get sexually inappropriate with you. Certain things are things that you have to overlook, understanding that there are issues. But if it is something you cannot overlook, I have told you already, if it's something maybe like sexually inappropriate, trying to do things that you don't, that is crossing the line, you bring that to the attention of your supervisor and the care team. Let them understand what is expected or what you can do. Now, effective problem solving, you can solve some of these challenges, but remember, most importantly, that you cannot solve a problem without understanding what that problem is. You can never solve a problem that you don't even know the cause of the problem. So when you understand the problem, you brainstorm possible solutions, pick a solution, make a plan and do it. Work with your care team. Get feedback about how it worked. That's just it. Because you work with people, maybe you have somebody that has been throwing tantrums, you have a client that is always behaving sexually inappropriate towards you, or maybe other things that you don't find comfortable. Discuss with your care team, brainstorm, let them come up with ways that you can salvage the situation, and then make a plan, go about it, and then discuss the feedback, talk about how it worked. If it didn't work, re-strategize. Nothing is cast on concrete. Now, there are some conditions that are problematic that don't make people to hear, like common conditions like hearing, you see, like that. Some have a hearing disability, they don't hear very well. So such cases, they need hearing aids that will help them, and you too, you ensure that the hearing aid is worn properly, just as you can see that woman. And it makes your work easier because when they wear the hearing aids, they get to hear what you are saying when you say something or when you need to get any information from them. And create a conducive environment. Don't be hostile, don't be wicked. By God's grace, as we progress, at a point, I'm going to play a video for you, maybe second day or third day, you are going to see some of the things that we learn. But to summarize everything that we have done, okay, these are some conditions: hearing loss or impairment, cognitive impairment, dementia. These are some of the things that makes that becomes challenging, some of the challenging situations that people have. These are some of them. Disability, working with interpreters, traumatic brain disorder can make them, because of all these issues, they can go above board and become difficult for you to handle as a caregiver. So now, at this point, in the next 10 minutes, on this particular slide, I want us to just watch this video, but before we watch the video is less than 5 minutes. So it's not something that will take our time. We will hit 8:30 on the dot as I requested. At this point, please, before we go into the video, is there any question so far? Do you want to ask any question? Or better still, let me wait after the video. You can then ask questions or we make any contribution. So now I'm just going to play this video. It's a very short one. I want you to learn 1 or 2 tricks and tips on how to handle challenging behavior. You see why some people actually behave the way they do. Just a short video. Thank you. So let's see. I would need to ask you at a point. I'll need to ask you if you can hear me. And don't know why this is actually okay. Oh, I'm trying to drag this so that it does not disturb us. What's this? What's this? All right, fine. So let's see if we are together. Okay, please, are we together? Can you hear? Is the volume, is it audible?
Not really. It's not really audible.
Okay, please, I would like to hear everybody so that, because I'm hearing only the voice of a gentleman, and that's not too good. It's as if it's another kind of disability when you have to talk to yourself. Another kind of disability when you keep talking to yourself.
Good evening.
Good evening.
We cannot hear.
Okay, I'm going to start it again and close that place. Just tell me if it is audible enough. Thank you.
The VA has developed this Caring for veterans with dementia can be both rewarding and challenging. The VA has developed this training program to help you adopt a more positive approach to address
Please,
veterans
are we
with
together? Is the volume better now?
Yes.
Yes, it is.
Okay, so I'm going to just play it again so we would see that this is the last thing we are doing. So just patiently relax and watch the video. Thank you.
Caring for veterans with dementia can be both rewarding and challenging. The VA has developed this training program to help you adopt a more positive approach to address veterans with dementia. In the following scenarios, you will first see a counterproductive way of approaching a veteran, followed by the preferred positive approach of engaging the veteran and addressing challenging behaviors. By learning these positive skills and techniques, you will not only experience better outcomes, you will honor veterans in the twilight years of their lives.
You haven't changed yet? Oh boy, looks like we've got work to do. Let me get some things to pretty you up. Okay, now, where to begin? No, stop! No, stop! That hurts! I'm just brushing your hair, no big deal. That hurts! Ow! No! Hello, Mrs. Jones. I'm Angela. Looks like you're ready to get your day started. Mrs. Jones, would you like to fix your hair and put on some makeup? Okay, great. Let's just walk over here so we can find your hairbrush. Here, your hairbrush. Some lipstick. What would you like to do first? Do you want to brush your hair?
Yeah. I was when they finish this thing. You're finishing. We're about to finish. After this, I will give you. Yeah?
I like how you're fixing your hair. It looks real nice. What's next? That color looks good. What would you like to do next? Sure, you can add a little blush. That'll add nice color.
Grooming tasks can turn into a major hassle or be a source of pleasure for veterans. Approach and cueing make a big difference. Systematic cueing involves giving step-by-step cues, increasing assistance as needed based on the veteran's response. See how the staff member begins with visual and verbal cues, and then, only when necessary, employs tactile cues. Visual cues are typically easier to process than verbal cues. Angela also uses hand under hand to get the veteran's attention and guide her to a place that is more familiar for grooming, such as a mirror and sink. Notice how the staff member uses hand under hand for grooming tasks as well. It allows the veteran to be more engaged and lets the staff member know early if there's a problem. Giving positive feedback to the veteran's choices also keeps Mrs. Jones engrossed in the process.
Morning, Mr. Hughes. Time to get ready for the day. Need to get dressed for breakfast, right? Eggs and sausage this morning. Let's see what we got in your closet. This'll work. What you think, Mr. Hughes?
No, stop.
Hey,
Stop.
come on. I need you to settle down
Stop.
now.
Stop.
You want to get dressed, don't you?
No,
Stop fighting me.
Stop.
Good morning, Mr. Hughes. Oh, I forgot. You prefer Willie. I'm John. I'll be helping you today. I see you're already awake. Great. Can I help you with anything before breakfast? Maybe we can start with changing your clothes. Let me help you up. There we go. Good, Willie. All right, almost there. All right. Let's see what you have to wear. Which shirt do you like? Do you want this one or this one? Which pants? This one or this one?
This one.
Nice choice. What's next? Let me help you take off your PJs. Let's start with your button. Thank you for helping, Willie. Let's start with your right sleeve. You're doing great. It's hard with arthritis. Okay. Your right hand. Good. Ooh. Thank you. I like this shirt on you. I really like the color. There we go. Good job, Willie.
This vignette demonstrates the value of the initial approach as you engage with a veteran. As you saw in the first scene, John was not able to establish much of a connection with the veteran. Willie remained upset throughout the interaction. In the preferred approach, John engages Willie using the positive physical approach. It's important to start some distance away, maybe 6 feet. Lift your hand to your face like saying hi or hey. Drop your hand as you approach, keeping the palm open. Pace yourself slowly. Take about a step per second so you don't startle the veteran. Stay to the side of the person at arm's length and accept the person's handshake. You also want to get down to the person's eye level without leaning in. Once you have made the connection in a supportive stance, offer the minimum assistance needed. In the preferred approach, John also uses fewer words because people with dementia may have trouble processing verbal information. He provides the veteran with simple choices and opportunities for the veteran to participate in the activities, consistent with the veteran's level of cognitive function. John also uses the veteran's first name, Willie, instead of Mr. Hughes, because the staff have assessed that is how the veteran prefers to be called, by his first name. By following these steps, you engage the veteran, respect their choices, and increase the chance of a positive outcome.
Hello, Mrs. Jones. Look at you, still haven't touched your food. Well, let me feed you some lunch. Here we go, just mixing it up. Now, take a bite. Yum, isn't that good? Come on now, you know you need to eat for strength. Hey, Jasmine, you must be done checking vital signs. Looks like I'm gonna be late to the staff meeting. I'm still with Mrs. Jones, who is taking her sweet time with lunch. Come on, honey, hurry up. Hello, Mrs. Jones. I'm Angela. May I join you for lunch? Lunch looks pretty good. We have soup, salad, chicken, and dessert. What would you like first? Let's try. Will you pick up your spoon? Were you trying to have some soup? Here it is. Let's try it together. Looks like you enjoyed it. You ready for another sip? Looks like we can keep going.
Veterans with dementia retain more abilities than many may realize. Your approach and nonverbal behaviors can make a big difference. Because abilities can vary day to day, you should assess the veteran with each encounter. In the second scene, the staff member uses simple questions, directions, and systematic cueing to figure out what level of support the veteran needs. Rather than simply feeding her, the hand-under-hand technique provides a better eating experience as you help the veteran become more engaged with eating. Watch how well this hand-under-hand positioning works. Make sure to approach from the veteran's dominant side. Offer your hand palm up. Slide your thumb next to theirs and wrap your fingers under their wrist. Then use your fingers to grasp the spoon or other items. You may need to adapt for veterans with a hand deformity or dysfunction.
Okay, so thank you so much. Are we together? Did we enjoy that short video? Okay, so practically, that is how why is it echoing? Please, can you hear me?
Yes.
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 Hey.
We can hear you.
Okay. Okay, so with this is practically the last happening. Just give me a minute now. Okay. Right. So we've come to the end. Why is it echoing? For God's sake. Please, can you hear me? Is it echoing at your end too?
Yes.
Yes, it is. It's echoing.
Yes, it's echoing from my end.
No, I don't know why it's doing that. I think it's better now. So what I was saying is, this is the end. Thank God we've been able to learn one or two things from this video. The way you handle the clients can help the client and make the clients to get better. You see the way the veterans were treated, the before and the after, and the reasons. You look at the practical steps. So caregiving is something that has got to do with the heart. If you are determined to do it, you do it because you are seeing, you can see how vulnerable they are. So that alone to touch your heart to ensure that you do all you can for them. So at this point, we have come to the end of today's training. Sorry, it's past 8:30. I don't know if we have any question. Do we have any question or any contribution to add before I hand over to MJB? But before I do that, I would like to say that in case you don't have your questions